Quiet down, please. Quiet down. Good morning and welcome to today's New York City Council hearing for the Committee on Mental Health, Disabilities, and Addiction. At this time, we ask that you silence all cell phones and electronic devices to minimize disruptions throughout the hearing. If you have testimony you wish to submit for the record, you may do so via email at testimony@council.nyc.gov. Once again, that is testimony@council.nyc.gov. At any time throughout the hearing, please do not approach the dais. If you have any questions, please approach a sergeant at arms. Thank you for your cooperation. Chair, we are ready to begin.
Thank you. I always forget how many times I got to do that. Good morning. Good to see all of you here today. My name is Linda Lee, and chair of the Committee on Mental Health, Disabilities, and Addictions, and I just want to thank everyone for joining us at today's hearing on introduction numbers 868, sponsored by Councilmember Oswald Felice, which would prohibit the distribution of hypodermic syringes and needles by mobile syringe service programs within 450 feet of schools and playgrounds. Introduction number 1169, also sponsored by Councilmember Felice, in relation to the safe collection and disposal of needles and syringes. And lastly, we are hearing Resolution 317, sponsored by myself, which calls on the state to mandate basic training in addiction treatment as a requirement for medical schools that receive state funding. Before I begin, I'd like to recognize we have been joined by the following council members. Of course, Councilmember Felice, who's here to give a statement. And then on Zoom, we have Councilmember Hanif, as well as Councilmember Abreu. And we have also been joined by, feel free to raise your hand, High School for Health Professions. If you guys are here on that section over there, welcome, welcome. And as I understand, you guys are AP government students. Very awesome. Hopefully you will think about a career in public service, which is amazing. I was in nonprofit for 20 years, so I really highly encourage you guys, whether it's on the nonprofit side or government side, think about public service and contributing to your community. So I'm just glad you guys are here. This is a big part of it, is coming in and listening to these hearings and learning about what we do on the city council. So I just want to thank you guys, as well as your teachers who have brought you here. Oh yes, Deborah Falmino, am I saying that correctly? Okay, and then also we have Mr. Logan, who I don't know if, yeah. You're a teacher, you look so young. Okay, got it. I was like, wow, you look very young for a teacher. Awesome, so thank you all for being here, I appreciate it. Last month, the committee held a hearing examining how the city is using money from the opioid settlement funds to address the ongoing opioid crisis, including investing in evidence-based treatments and harm reduction services. Harm reduction is a critical public health strategy that saves lives, promotes safety, and fosters healthier communities. In New York City, harm reduction services play an essential role in reducing the transmission of HIV, hepatitis C, and other infectious diseases. Research consistently shows that such programs reduce harm without increasing drug misuse, making them a vital part of our public health infrastructure. As we continue to expand harm reduction efforts, we must also work together to ensure that our communities remain safe and free from syringe litter. Safe syringe disposal is a shared responsibility, one that protects public spaces, prevents accidental needle sticks, and fosters trust between harm reduction programs and the neighborhoods they serve. Balancing harm reduction with community well-being requires collaboration between public health officials, harm reduction advocates, and local residents. By continuing to invest in both syringe service programs and effective disposal solutions, we can build a city that prioritizes both compassion and public safety. I want to turn the mic over to Councilmember Felice at this moment to make a statement about his bills that that we're discussing today.
Thank you so much. Good morning, everyone. I'm Councilmember Oswald Felice. I want to thank you, Chair Linda Lee, for this hearing. Proud to have two bills being heard before this committee today, bills related to needle exchange programs. I'll start by saying what we all know. These needle exchange programs are life-saving. They ensure that those suffering from addiction-related issues, it ensures that they get access to safe needles so that rather than using and then reusing used needles, which can further exacerbate health issues, it ensures they have access to safe needles so that they don't create new health issues. These programs are life-saving, but we have to make sure that we, as a city, implement these programs properly and responsibly. We've had major issues with how the Department of Health has implemented these programs. First, not honoring the exchange part of the program. Rather than exchanging, simply distributing hundreds of needles in a community. And even worse, distributing hundreds of needles with no plan on picking them up. The result, hundreds of needles being scattered in all places of our community. Last week, I received one of many pictures of needles found at the front entrance of a children's elementary school. Nobody should ever tolerate something like that. So unacceptable and irresponsible. The second problem, placing a needle distribution truck, not only inside a park, but directly beside a children's playground. Placing a needle distribution truck, distributing hundreds of needles on a daily basis, directly beside a children's playground. And again, distributing with no plan on picking them up. The result, hundreds of needles being found in all places of that park, including inside that children's playground, creating safety risks for children in low-income communities. This is something that nobody would ever imagine doing in a wealthy community. The worst part of all is that concerns brought to the Department of Health have been nothing but dismissed. I don't know when it became okay to dismiss quality of life and safety concerns of low-income disadvantaged communities, but proud that we have these two bills to help resolve that. Again, these needle exchange programs are life-saving, and I would even go further. They could even be expanded, but we need to make sure that we implement these programs properly so that while trying to resolve one issue, we don't create other issues. Having used needles in a children's playground, that's a tragedy waiting to happen.
Thank you, Councilmember Feliz, and thank you for your testimony, and we're looking forward to hearing the administration's responses to these bills. So I just want to conclude by thanking Assistant Commissioner Rebecca Lynn Walton for being here. You seem very lonely because usually you have more people with you on the panel, but you're by yourself lonesome today, but we will make sure that you are well taken care of. And also on a separate note, I just want to say that I know that this topic may sometimes come across and is controversial in some communities, but the reality is that especially in a lot of the communities that I used to serve in the nonprofit sector, a lot of this is very hidden. People don't talk about it. It's an issue that is very prevalent. And behind closed doors, I have a lot of conversations with folks from various different communities about this issue, especially with the opioid crisis that's happening right now and the syringe crisis. And it is something that hopefully through these bills, we can get closer to finding a solution, which is what we're looking forward to today, is hearing both sides of the argument, right? So we want to hear the pros, cons, all of that to basically, create a bill that works the best for the community. So looking forward to hearing from both sides today. And just thank you so much again to the organizations, the advocates that are here, and members of the public. Also want to thank the committee staff who've worked so hard in preparing for this hearing. Thank you all so much. And I will now pass the mic to the committee counsel to administer the oath.
Thanks. Now, in accordance with the rules of the council, I will administer the affirmation to the witnesses from the mayoral administration. Please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to council member questions?
I do.
Thank you. Prior to delivering your testimony, please state your name and title for the record, and you may begin when ready.
All right. This is weird sitting alone. Hi, I'm Rebecca Lynn Walton. I'm the Assistant Commissioner for the Bureau of Alcohol and Drug Use at the New York City Health Department. So good morning, Chair Lee and Councilmember Feliz. I'm Dr. Rebecca Lynn Walton, the Assistant Commissioner for the Bureau of Alcohol and Drug Use at the New York City Department of Health and Mental Hygiene, the Health Department. Thank you for the opportunity to testify today on Introductions 868 and 1169. Overdose deaths continue to be a public health crisis for every community in New York City. Last month, I testified at the Mental Health Committee on the Health Department's deployment of opioid settlement funds to address the crisis alongside our city and state partners. I highlighted our strategic goal to reduce overdose deaths by 25% by 2030. This goal is central to Healthy NYC, the city's roadmap for increasing average life expectancy. We are proud to have worked with the City Council and Health Chair Schulman on codifying Healthy NYC into law last year with a unanimous vote. I also described the data we produced to enable the city and community partners to make informed programmatic decisions and investments. In October, we published the 2023 annual summary on overdose deaths. The number of overdose deaths in 2023 was 3,046, a 1% decrease from 2022, marking the first decline since 2018. Additionally, according to provisional data in 2024, there were 616 overdose deaths in the first quarter, the lowest quarter on record since 2020. This is a welcome stabilization after years of a continual increase. These findings help us better understand what's working and where we need more investment. There's still a tremendous amount of work ahead. One overdose death is too many. While overdose deaths are starting to decrease in some neighborhoods, there are many communities in which numbers remain alarmingly high. Inequities persist, often as a result of decades of neglect and underinvestment in these communities. Certain populations, such as older Black men, Latino New Yorkers, and women, have seen increased overdoses in recent years. In September, the Health Department published the most recent analysis of maternal mortality. It is troubling to see that mental health conditions emerge as a leading cause of pregnancy-associated deaths in 2021. The majority of these deaths were caused by overdose. The Health Department remains committed to addressing this crisis by expanding access to stigma-free, evidence-based services as part of a comprehensive strategy to address the overdose crisis and support healing in the communities most harmed. Everyone who uses drugs is a neighbor, a friend, or a relative. Respectful support is the only way to stem the tide of this heartbreaking crisis. Syringe service providers, SSPs, are invaluable resources in this work. They are community-based organizations designated as New York State Licensed Syringe Exchange Programs, SEPs. The Health Department contracts with 14 of these organizations. They provide syringes to reduce community spread of infectious disease, along with a myriad of other essential services. I will refer to this network of 14 community-based organizations as SSPs going forward. To fulfill their state license duties as SEPs, SSPs offer access to sterile syringes and safe syringe disposal. Some have dedicated teams to collect and safely dispose of used syringes found in the communities they serve. Additionally, they provide a range of health services, including referrals to or on-site physical and mental health care, opioid addiction treatment with buprenorphine, naloxone distribution, overdose education, HIV and hepatitis C testing, and counseling, drug treatment counseling, support groups, and drop-in centers. These services offer key opportunities for connections to care. Treatment and recovery go hand in hand with harm reduction. SSPs are also help clients meet their basic needs, providing laundry services and showers, hot meals, menstrual supplies, and clothing. They offer a critical window of opportunity for connecting clients with all of these life-saving services that can be tailored to their unique needs. These organizations each sought to address the unique needs of their fellow community members by independently pursuing licensure from the state health department to get proper authorization to establish and operate a syringe exchange program. They successfully organized to secure resources to address issues in their communities that are a result of decades of neglect and underinvestment. Once licensed by the state, SSPs are subject to the rules and regulations promulgated by the state health department. These regulations set standards for how these organizations must safely distribute and collect syringes. Regulations are based on decades of research and community feedback. The health department is tasked with addressing the overdose crisis and controlling infectious disease, and it is within our mandate to protect the health of all New Yorkers. We support this network of community-based organizations with these dual purposes. Once an organization becomes licensed by the state, the New York City Health Department may contract with them to provide financial support and technical assistance. As discussed in the hearing last month, New York City Health Department will use $4.1 million of the opioid settlement funds to expand wraparound services at all 14 SSPs starting in fiscal year 2026. The Health Department also recognizes the public safety and quality of life issues with syringe litter. This is a growing concern, and the city takes this issue seriously. We are working closely with our partners in the Parks Department, Sanitation Department, and other city agencies to better address syringe litter, which is one of the many negative impacts on communities most impacted by the overdose crisis. Thanks to Deputy Speaker Ayala and the Council, we are proud to launch the Community Syringe Redemption Program this spring. This is a novel addition to our layered approach to addressing syringe litter in parks and other spaces where complaints are highest. The Redemption Program will engage people who use drugs, train people on safe syringe disposal, and financially incentivize them to safely return used syringes, which will reduce the risk of improper disposal. This will also offer another touch point to connect folks to health, treatment, and other wraparound services. Other cities with similar programs saw fewer complaints and more vibrant public spaces. The organizations we're discussing today, SSPs, offer participants options for safe syringe disposal and conduct syringe litter cleanup in the neighborhoods they serve. These organizations are the best way to address our shared goals of reducing infectious disease and overdose deaths while reducing the risk of syringe litter. SSPs reduce syringe litter because they educate program participants on safe disposal and offer receptacles for safe disposal. As previously mentioned, 6 of these programs offer support outreach and syringe litter teams. These teams pick up syringe litter and engage with people in the community to connect them with their services. The reality is that not everyone who uses drugs visits an SSP. We are always trying to connect with more people to these services and would appreciate the Council's partnership in supporting and protecting these critical services. Before I answer your questions, I'd like to briefly discuss the legislation being heard today. Introduction 868 would prohibit SSPs, organizations acting as state-licensed SEPs, from conducting mobile syringe services within 450 feet of schools and playgrounds. Proximities to schools and playgrounds and other community assets are always considered by the SSPs when citing mobile services. These organizations use our data to engage communities with the highest existing overdose rates. The Health Department works closely with community boards and other community partners to respond to syringe litter concerns. The Law Department is reviewing the bill and considering the role of state oversight in these programs. We've generally deferred to the New York State Department of Health regarding the designated location for SEPs. Introduction 1169 would require SSPs, organizations acting as state-licensed SEPs, to collect and dispose of all syringes distributed to community members. Many of the proposed requirements in the legislation reflect core functions of SSPs already in operation. This includes providing guidance for program participants on safe disposal practices, maintaining safe syringe disposal receptacles, and ensuring staff are properly trained on collection of used syringes. The Health Department has concerns regarding the requirement to collect a similar number of syringes to the number distributed. This comparison does not align with the reality of syringe litter and SSP operations. Clean syringes are available in hundreds of places in New York City beyond these 14 organizations. We also have concerns regarding the requirement to collect syringes distributed by the program, but not returned by program participants. In practice, this seemingly small change would pose significant operational challenges that could impede the SSP's ability to provide services and reach new clients. This requirement may conflict with the operations of the previously mentioned syringe redemption program. Together, these dynamics will create confusion and operational obstacles, which will increase barriers to life-saving services, those that are critical to achieving the Healthy NYC goal of reducing overdose deaths and controlling the spread of infectious disease. Syringe exchange services are proven public health interventions backed by decades of research and science. The city supports a more aggressive response to syringe litter, but these changes may actually have the opposite intended impact, increasing syringe litter and negatively impact the health of all New Yorkers. We cannot afford to remove or impede any tools that we know reduce overdose deaths. States and municipalities that rolled back syringe exchange services have seen increases in HIV cases and other grave unintended health consequences. The Health Department remains committed to supporting evidence-based interventions that reduce the spread of infectious disease and risk of overdose death. We are also committed to partnership with the Council and other community stakeholders to find more solutions for syringe litter impact on quality of life. Thank you for the opportunity to testify, and I look forward to answering your questions.
Sorry, just bear with me. I'm old school and have to handwrite things, which takes longer. Okay. So I have a list of prepared questions, but I just want to start off with questions that sort of came to my head as you were going through your testimony. So let me start with the last first, actually. So if I'm understanding correctly, is it fair to say that you are supportive of getting rid of the syringe litter, but not at the expense of reducing the distribution of it? Is that fair to say?
Yeah.
Okay, I just want to make sure that I'm understanding that correctly, because I just want to make sure that there's no confusion with the fact, like, so you are on board with more efforts to do the litter cleanup, all of those things?
Absolutely.
Okay.
We couldn't be more strongly for no one wants a single syringe in a public space, and we absolutely want to figure out what are all the layers we need to fix that problem.
Okay, so I guess my question then is, when you say that you support a more aggressive response to syringe litter, but these changes may actually have the opposite intended impact, can you give examples of how you could see that happening? Like, what do you, if you could go into detail? Sorry.
Yeah. And I'm really proud of the work we do, and we talked very closely with these providers to talk through what are all the ways in which this might impact the work you do. And so there's one issue of having someone be responsible for returning all of their syringes actually goes counter to what we know, is that if you give someone a safe way to dispose, it could be at their local pharmacy, it could be in a container that you give them, that keeps everyone safer. We don't want anyone bringing bags of used syringes anywhere where they could injure themselves or others. So that was one of the things that we're concerned about.
Okay. And then I know in the testimony you mentioned that concerns regarding the requirement to collect syringes distributed by the program, sort of touching upon the point you brought up, distributed by the program but not returned by program participants. So do you know what the current percentage is right now of participants that return their needles? In other words, what is that correlation between the rationale that you want to make it as accessible as possible for them to return it? What's the current percentage of folks that do versus why these needles end up all over the place in the neighborhood?
Yeah, so there's a couple factors going on here. So one is that we know from decades and decades of experience that community syringes are not all coming from SSPs. On top of the 14 providers, there's hundreds of other places to access syringes because we want people with diabetes and other illnesses that require access to syringes to have both safe syringes and disposal. On top of that, we also know that the escalated opioid crisis is meaning that many people are getting syringes outside of both of these opportunities. And that's why the outreach teams being in the streets talking to people that they haven't previously engaged is so vital to the outcome, because we know there's a large number of syringes, and lots of cities have found this too, that they're not coming. So we don't, unfortunately, tell you for every syringe this one's coming back, because we know that that causes a chilling effect, and other cities, when they've implemented things like this, people don't come in for services, which means that they're immediately going to non-safe ways of getting syringes.
But is there a way to track that internally? Meaning, because I've been to some of these SSPs and I think they're doing really great work, and I know it's very, very challenging. And it's also interesting because of how the dynamic is in some of the neighborhoods that they are in.
Yeah.
And so I this is like my social work hat coming on, but I think a lot of the services they provide, aside from the needle exchange programs, are incredibly important. And it does give them that space to come in. So, but just out of curiosity, so is there a way, though, going back to my question, to track it internally, meaning in a way that is not prohibiting them from feeling comfortable from coming in, but like if I, Linda Lee, take one, can you track to see if I bring one back? Like, not in terms of the exact, is there a way to track that? Or
the 1-for-1 causes what we know will be a huge danger to workers, because what you're asking them to do is sit there looking through bags. So what they've done over the decades of these programs is come up with ways to measure bulk. And so we measure how many syringes are coming back in our receptacles, in the parks receptacles and kiosks. And we do so by saying, what's the weight of the bag? And you divide it by the weight of a syringe. And that keeps everyone safe and healthy, because we don't want needle stick injuries to the community workers who live in these very communities that they're serving. And so
Yeah.
it isn't a one-for-one, but we are aware that they also get back large numbers of syringes. All of the providers of syringes across the city also receive back a large number.
Okay, sorry, so let me rephrase my question a little bit, because I definitely don't want to, not that, I didn't mean literally one for one sort of, because obviously we want people to be safe, but is there a way to figure out, and I guess you're kind of alluding to that, is that based on the number of participants that we have in the program versus the weight, let's just say, of the needles that are brought back, you can sort of guesstimate about how much percentage-wise people are actually bringing back to the centers, right? Is that accurate?
Don't collect it like that because we offer so many at-home options to dispose of. The same way that when you pick up your syringes with your insulin, we don't want you bringing it back to the
Right.
pharmacy. You get that freedom to dispose of it in your home. And also just want to share as well that because we know that 70% of overdoses occur in private homes, we know the vast majority of people using substances are doing so in their own homes. And so providing them receptacles so that when they throw it out in their garbage, it's also not injuring any sanitation workers, makes everyone safer.
Yeah, okay, so then let me rephrase my question again. Because I think the root of my question that I'm trying to get at is how are we making sure that this is actually working in the sense, in the broader sense, right? You know, obviously taking into factor that we want people to dispose of them safely, definitely 100%, whether you're in home or somewhere else, like obviously we want safe disposals. But is there a way to track if you have all these folks that are coming in for the program, that these, that I'm just trying to get a broader sense of if this is actually working.
I
and how
know,
to track
it
that, yeah.
seems like it should be that you should give out as many as you give back. Decades of research does show that you hand out more than you get back because you're offering
Right.
at-home opportunities. So the syringe litter teams have picked up almost 200,000 syringes, I believe was the number for last year. And so they pick up many, many, many syringes. They get many, many syringes, or it may have been a combination of the outreach teams actually and the disposal kiosks as well was the almost 200,000. So they're getting a huge quantity. But the issue we're trying to solve for is the people who aren't accessing the SSPs, which is what a lot of
folks
research
that
in
are not.
cities are telling us. That's where the bulk of ground syringe litter comes from.
Okay, sorry, I'm just thinking in my head right now.
I
Okay.
know, and public health is always very long and complicated, which
yeah,
makes it
no.
seem like there should be an easier answer to it, and I apologize that we're all struggling through this.
No, I know public health, I mean, because, again, through my former, work in the nonprofit sector, we did a lot of public health work, which is more looking at, for example, we did a whole, a lot of Asian Americans, for example, have very high, blood pressure, hypertension. And so it was a lot of long-term solutions with working with the grocers, the restaurants, all of those solutions to try and figure out how do we change the behavior of the community from a community perspective. So it definitely takes a village, I will say that. So it has to be a multi-pronged approach. Okay, so really quick question about the funding. So so I know that you had mentioned that you will use 4.1 million of the opioid settlement funds to expand wraparound services at all 14 SSPs starting in fiscal year 2026. Does that also include the cleanup efforts, or is this specifically just for the programming aspect?
These are for the programming aspects to get more people connected to services and care and help them on their way to health. And so the syringe redemption program, which I think you're speaking to, we're self-funding.
Okay, and then is there another piece of the budget somewhere that would actually put more funds into, helping with the cleanup efforts at all? Or is that included in any of the opioid settlement funds generally, or no?
Yeah, so I mean, the OSL teams predate opioid settlement funds, so that was a layer we put in place recognizing the community need for syringe litter. The park kiosk, so not through the opioid settlement funds, but that's because it's part of a larger continuum that we talked about last month with trying to support that. So no OSF funds are directly going to expand that, but they will expand access to mental health care and access to other treatment and all of the other things that the SSP SSPs have actually been asking us for, and one of the things I'm very excited about as a social worker is things like mold remediation, so that we can keep our workforce healthier as well, so that they can have safe, beautiful, and respectful places to be doing care with New Yorkers.
Nice, thank you. So just to clarify, because I know that you had mentioned parks and sanitation. So are those the only city agencies that are partnering to currently ensure that the public spaces like the parks and playgrounds are free of syringe litter? Is it those two mainly, sanitation and parks, or are there others?
No, part of what I love so much about working in city government is so we have many mass, all the organization meetings, so we work very closely with DHS, and then sometimes we find that our outreach workers and their outreach workers would actually do better to just let our community providers be doing the outreach together. So we're working hand in hand with DHS, with parks, with sanitation, with NYPD, with if they're interested, we'll bring them in, you know? So we have many meetings where we're trying to figure out what are all the different angles, because there's a safety angle. Maybe in some neighborhoods, the issue is more sales, and in other neighborhoods, the issue is more street homelessness, and in other neighborhoods, it might be substance use or mental health, or a combination of all of those. And so you want all of those players at the table to figure out what is each agency's piece of that, and how do we work more effectively with community providers.
Okay. And then when you work with the community providers and collaborate, how do you pick the locations? Is it based on complaints made by the public, or is it also, areas, high need areas where you know that there's going to be a lot of?
It's all of it. And when your letters come to us, we go out and we try to work on those areas as well. So we definitely try to take into account data, but also data can come from community voices as well. We've had community boards reach out, say, hey, can we do an effort around this? Borough presidents, whoever's asking, we always respond. And we want it to be something that we're all working on together.
Okay. And then do you also, if folks have concerns about that, should they call 311? Is that something that they would do, or which is the route that they would take?
If you see a syringe, is that the question?
Yes, so what mechanisms exist for the public to make complaints to the city about the presence of excess syringe litter in public spaces?
Yes,
Yeah.
absolutely. So we also list on our health department website, please don't pick up any syringes. We don't want anyone who hasn't been trained to get hurt. So you should call 311, and then if it's in a public space, it goes to sanitation. If it's in parks, it goes to parks. But they also talk to us on a regular basis, and if they say, hey, we're seeing an uptick of complaints, that's how the outreach teams came to be. And so we're really trying to work together to filter that into our decisions at a city level.
Okay, and then once you find that there's let's just say you tracked the data for 311 calls and found that there were a number of cases coming in from specific neighborhoods, how then would you address that moving forward? Is it something where you would then ask the SSPs, hey, can you guys pay more attention to this area and get them involved, I'm assuming?
Yep. We have weekly contacts with them, could be a text even, saying, hey, we're hearing an uptick in this area, and we send an OSL team out. We were doing a walkthrough with an elected recently, and there was an issue on the street, and one of our SSPs had already responded on the street to the individual to help provide them support. So we're constantly in contact with both our community providers, because we know that sometimes you don't want a government official coming to talk to you, or a government employee coming to talk to you, a peer, and maybe they don't know I have lived experience, but they want a peer on the street coming to talk to them. And so that's key to it. So we're constantly in contact figuring out what is the issue and then how to respond to it.
Okay, perfect. And just switching gears a little bit to Local Law 124, which I know you talked about briefly, which is Deputy Speaker Ayala's bill, and it is set to start in April, you said, or around spring?
Yeah.
Okay.
Finalizing contracts.
Got it. Okay. And can you just clarify the status of the needle, syringe, and sharps buyback pilot program? So I know you said spring. Are you, how is it going to be implemented? And also, evaluated, just out of curiosity, because I'm curious to see how we're going to measure whether or not this is successful.
Yeah, so we're really lucky that we're working with the group from Boston, who's the only other successful group to have implemented this, and they've seen a 50% reduction in ground syringe litter in Boston since the program started 4 years ago. So for me, that's my main metric I'm looking at, is ground syringe litter. So how it's rolling out is in the spring. They're going to be working we've already started working with the SSPs to plan for that. We want to get people enrolled. They're starting with enrollment of people who are in SSPs and want to be part of that so that they can get enrolled and trained up to do so safely, pick up syringes from the ground or dispose of their own syringes rather than leaving them on the ground. And so then we'll be rolling it out across more locations. There's going to be 8 locations, and part of the project is to do an evaluation that we're really excited about. We're working with Boston. What are their metrics, and are there anything that we think they've missed that we can add to it?
Perfect. That was actually my next question is, you mentioned 8 locations. And are those also in the 5 highest need council districts, ensuring at least 1 per borough? And also, how do you plan on maybe rejiggering some of those locations as the program evolves?
Yeah, I would say rollout always means rejiggering as you go along, and you want to make sure it's working. You can't just go, this was our plan, and then it's not working, and sorry. So we looked at a list of the highest syringe litter complaint parks and areas, but also we're conscious about not wanting to be next to things like schools or houses of worship or other places where the services are not needed. Right. And so we took that into account, but then also had to be proximity. So we needed locations to be about an hour away so that we could cover the most ground over the course of the week.
Okay. And then is there a mechanism to incorporate feedback from community members and the SSPs? Obviously, I know you regularly talk to them, but community members in terms of the ongoing pilot program?
Absolutely. That's who we want. We plan to be at community board meetings. We plan to be talking to any other ways you have for us to be engaging with community members. We want to know it's working, and we want to know that people are also knowing about it. Maybe they don't know it's going to be in their local park, and they haven't been going to their local park because syringe litter is an issue. We want them to know it's clean. Please come back and please be part of New York City park life because it's so important to all of us.
Yeah, and I know that sometimes with the pilot programs, you know, some folks want to have community advisory boards or committees, and others, you know, I know that some of those things can come up. So is that something that you've all thought about as well in terms of what you said? Like maybe that could include a community board member as well as someone from the SSP, someone from NYPD or Parks, just to make sure that things are working.
We haven't thought of an advisory board. I think that's genius, and I'll be taking that back to the team, and I think they'll be pretty excited about that.
I have to say, in my experience with different programs that have been maybe seemingly controversial at times, I took the initiative to start a community advisory board for one of the programs in my district that was, you know, causing concern in the neighborhood. And I have to say it worked well in the sense that it really sort of had them cooperate more, and they felt heard. I think the community members felt heard, and they felt like their concerns were being heard. And then they also had direct access to the folks that they needed to contact. So I just feel like it helps with the neighborhood folks, and then also just helps to make a smooth process and communication. I think communication is key, and oftentimes they feel like they have no one to communicate to in terms of their frustration. So, okay, perfect. I want to recognize Councilmember Mealy, who I know had to step out for a second, and also Councilmember Mamarato. I will go ahead and, I don't know, Councilmember Feliz, if you wanted to go ahead and ask questions first about your bills, if you had any. Okay.
Thank you so much. Thank you, Chair Lee. Just want to start by repeating what I mentioned earlier. These programs are life-saving. They're life-saving, and they're also successful in many ways. And even more than that, I think there are ways that we could even go further and expand them. But I think the question before us today is how can we install basic standards so that syringes don't, on a daily basis, hundreds of syringes don't end up in front of our elementary schools, inside our parks, inside children's playgrounds, and much more. You mentioned earlier today that there's a lot of steps that DOH is taking to make sure that that's not the case, including the 311 calls, the different meetings, the responses, and also installing places where individuals can discard the needles. The reality is that none of that is working. None of that is even close to working. And just want to talk, I guess I'll start my questions on your position on the bill. So the bill doesn't require, the bill doesn't require that providers pick up every syringe in the vicinity. I know earlier you mentioned that there are different providers that are providing needles, including city-related providers, state, and much more. This bill does not require that providers pick up every single syringe in the vicinity. What it requires is that providers play a role in cleaning up the issues that we're seeing by picking up more or less a similar amount of needles that they're providing and are not brought back. It does not require that providers pick up every single syringe. Of course, as you mentioned, that could get messy given that there's different levels of government providing needles. And the second thing is, this bill also does not require that participants bring back needles. What it requires is that providers and the Department of Health play a role in helping resolve this issue by, number one, creating a plan to make sure that those needles that are provided and not brought back are picked up by the DOH and trained professionals. And you mentioned training as an issue. This bill also requires that DOH and providers train on that issue. So a few questions. Can you repeat your position on the bill that prohibits distribution between 450 feet away from a children's park and an elementary school?
Yeah, happy to. The Health Department opposes it as drafted because proximity to schools, playgrounds, and other community assets are considered by the SSPs when citing mobile outreach services. They're sensitive to the importance of providing services where the need is, and while protecting public spaces used by children and families. Locations are based on community needs, including overdose rates, syringe litter complaints, which sometimes happen in those parks and playgrounds, and so they want to be nearby to pick them up. The Law Department is reviewing the bill and considering the role of state oversight in these programs. We have generally deferred to New York State Department of Health regarding regulation of designated locations for SSPs as they are state-licensed SEPs.
So are you supportive or no?
We oppose as written.
You oppose the 450 feet rule. Okay. So talk to us about the mobile distribution programs. We refer to them as mobile needle exchange programs. But how many of these programs are actually exchanging versus simply distributing needles?
They're all exchanging. So it's not that I hand you one, you give one back, as I said before, but they may get more back that day. They may not be asked for any syringes that day, but any needle that needs to be safely disposed of, they're taking back. So the mobile teams are actually, we call them syringe services programs because we put the emphasis on all of the services they're providing. And so in the course of their day, they may not hand out a single syringe. If the need is there and someone needs a clean, sterile syringe, that is what state license to distribute, but they are also doing things like bringing someone back. If someone's in the park and seems in need, they can come back to the drop-in center. They can get hot food. They can get tested for HIV. They can get tested for Hep C. They can get access to medication, and we can stop community spread. That's why they've been so effective in reducing HIV levels across the city.
Yeah, so I think that's where we have the confusion. You're referring to it as an exchange program. But generally, when you exchange, you're giving something and you're getting something back. You're saying that's an option. So you have the option to exchange, but it's truly not an exchange program. It's a distribution program, and you can also bring back needles if you have and want to bring them back. Is that a fair assessment or description?
I think the description is that the exchange happens in a wide variety of places across the city. And so what we're doing is working across those syringe services programs, which are state licensed, to make sure that people know about all the various ways to safely dispose of their needles in their home, in the local pharmacy, in a hospital. I used to work at Health and Hospitals. We were always making sure our kiosks were up to date and safe access so that someone can come in anonymously and dispose of their syringes. So I don't think the evidence doesn't show that 14 programs is going to solve the syringe problem, and so we're working on making sure all of the various wraparound ways someone can safely dispose are available.
Okay, but just to be clear, you're distributing needles and giving the option of also disposing, but it's not exchanging where you're basically requiring that individuals bring back some needles in order to get more. And I'm not saying that I'm supportive of that idea or requirement, but just want to get the rules of your policies and practices, just want to get them clear. So you're not requiring that individuals bring back needles. They can get without.
The state has found that that's not effective, and so we fully defer to them, and that if you offer safe disposal, the vast majority of syringes people get at SSPs are safely disposed of. The same way people who deal with diabetes are learning how to dispose of their syringes once they've given themselves insulin.
Okay. Are there any programs that require that you bring back before you get a needle?
We don't, because they focus so much on education rather than requirement, because
Right,
that
and
seems to be much more effective.
Yeah, and education is really important, but obviously that's not enough. Based on what we're seeing in our communities, that's not close to being enough. I'm just asking these basic questions because I just want to make it very clear that even though we continue to use the word exchange, we're not really exchanging. We're distributing and giving the option to bring back, but we're not exchanging. Exchanging is, I give you this coffee, you give me a cup of water, that's an exchange. You give me something, I give you something. But if we're not exchanging, then we shouldn't use misleading words to sell an idea. And I'm not making a point about whether the idea is a good one or bad one. My point is, the needle exchange program, that's a very misleading way of describing the program, because you're not exchanging anything, you're distributing.
And I think it's important to uncouple the community syringe litter issue from SSPs, that it's not 14 programs that are leading to the opioid crisis we're having, the affordability crisis that is causing so many people to be unhoused in New York and causing so much burden on community and loved ones about people's need. And so what we're trying to do is address that issue by having OSL teams go out and address those syringes that are most likely not coming from the SSPs or the hundreds of other locations to get. Thank you, just got a note. So the exchange word is the state word. So we use syringe services program because we want to be more clear about what we're doing. We're providing lots and lots of services. Some of that is needle services, and lots are coming back to us as well. But I do think the most important piece is to uncouple the public litter issue that we are very, very focused on addressing from the syringe services programs.
Yeah, okay. Is there any, well, actually, how many mobile programs do we have in the city of New York? And also, do you have a breakdown by borough?
So of those 14 programs, one of them is mobile only. I believe
Maybe we can focus on the mobile ones, not the storefront ones. How many mobile
Yeah,
programs?
that's what I'm saying. So many of the programs have mobile services. I'm sorry, I'm just trying to find the exact number. I believe there are 20 mobile locations across the city. They are across all 5 boroughs, and they're all working in communities where there is high incidence of overdose and HIV rates and all of those things that they're trying to accomplish. But we can get back to you with the exact numbers.
Okay, so I have a lot of questions. I'll ask one more, then I'll give it back to the chair. I'm sure everybody has more questions. But it seems like the Department of Health acknowledges that it's an issue that has gone unresolved, right? Can we agree that that's the case? I mean, I've reached out for 3 years about needles everywhere, in children's playgrounds, in front of elementary schools, and 3 years later, we still have the same issue. Can we agree that the issue has gone unresolved?
Oh, it's not fixed. And so that's why, since I've been there, I know I've spoken with you in your office multiple times. I know we've responded to your letter. We're here today to talk about it. We've layered on more and more things. I'm not saying in any way the problem is fixed, because if there are syringes in a park, the problem is not fixed. But what we are trying to do is do everything we possibly can to remediate the problem, to make things better, because I want children to go to a beautiful park. That's why I come to work every single day, and why it's so important to be working with parks, to be working with sanitation, to be working with the communities. So please, please, please don't think that we're not taking it seriously. It's just a long, complicated problem, and we're in the middle of an opioid epidemic. And so what we're doing is trying to use every skill and tool we have at our resources to address the issue with the goal of fixing the problem. And you're right, it still continues to be a problem. And please, please know that we're all working very actively to solve it.
Okay, and again, I agree with you. These programs are important, But the big question before us is how can we implement basic standards, such as not placing a needle distribution program, not giving out hundreds of needles in front of an elementary school. So the question before us is, what are basic common sense standards that we could implement? And I'm very confused about administration that talks about public safety, quality of life every single day. I'm confused about that administration not agreeing to something as basic as not distributing needles right next to a children's playground or a children's elementary school, which we know are going to end up around that vicinity and could potentially cause a tragedy for very young children. Also, and final question, I promise. I don't get your position on the picking up of needles. You agree that it's an issue that has gone unresolved, and the bill doesn't require that DOH and providers, and again, not participants, I know you mentioned that earlier, that's very misleading. What this requires is that the Department of Health and providers, which are general professionals on the issue, that they pick up needles. I don't get, if that's an issue, I don't get why the DOH and providers are willing to give out hundreds of needles in front of a children's elementary school, but they don't want to play any role in the cleaning up of syringes. That's what you're saying. You talked about the Parks Department, sanitation. They're great partners. Their resources are limited, but it seems like DOH wants to create a problem and not play any role in resolving it. And I think that is irresponsible and unacceptable. And that's, if you read the basic text of the bill, that is the only thing that this bill is requiring. It's not requiring that you pick up every syringe provided by the city or the state or anybody else. Just pick up a somewhat similar amount that you provide and it's not returned.
And I think the only thing that's not happening the way you're stating it is that we contract with local providers rather than doing it out of our offices, because we think it's much more important to get dollars into the community, to invest our dollars into the community. That's what the opioid settlement funding is supposed to do. We're trying to get it out there so that community members leading the organizations are having access to it. And I do just have to say that it's not the case that people don't care and don't want to fix the problem, that there hasn't been anything to improve it. We have seen parks cleaned up. We have seen layers and layers of more and more happening. That's why we're starting new programs, because we're constantly trying to get further towards fixed. It continues to be a problem because we continue to be in the smack in the middle of an opioid epidemic and crisis. And so what you're seeing is a crisis happening that we're responding to, and it's going to take time. We had a 1% decrease. That's not much. It's something that's really important as a clinician for me, because there were so many years where I was just seeing people I was working with dying, and so it's so important to see people start to stabilize, but we're not there yet. And so that's what people are seeing in their community. They're seeing the pain right there laid out for them of the opioid epidemic. And so we're trying to work on that. But it takes time and it takes new things and new programs. And so the health department has invested our money in outreach workers who do pick up hundreds of thousands of syringes through kiosks, through outreach workers. We're picking up many, many, many syringes. All of those state licensed facilities and pharmacies, they're picking up syringes too. It just continues to be a problem in certain areas, and that's why we're constantly saying, but what can we do for this area? If it's working over here, what are we not doing here that they need to help it work over there too?
Okay, and again, I get it. We're in a crisis, and we need to take every step to help resolve that crisis. But the big issue is, how do we resolve that crisis without creating new problems for communities? And you mentioned that parks are getting cleaned up. They're not getting cleaned up. I encourage you to visit St. Mary's Park in the South Bronx, one of the poorest zip codes in the entire city, or Echo Park in my district, another very poor district zip code. I encourage you to Google St. Mary's Park and enter needles, just so you can see the history of how many times, for how many years, these communities have complained and the issue has gone unresolved. So parks are getting cleaned. That is not true.
Some parks have seen improvement,
it's very clear that this administration is interested in resolving an issue, but is not serious about resolving the problems or install basic standards so that further issues are not created. And I'm very confused that this administration is allegedly a quality of life and public safety administration. It seems like that's nothing but words.
I actually have a couple clarifying questions based on your questions. So is the opposition to the 450 feet rule in a school because, from what I think I'm hearing you saying, is that the reason why you're opposed to it is because it would sort of almost be redundant to the requirements of SSPs and not allow them to do their work within a certain feet of schools, which actually does include syringe pickup as well, if I'm understanding I just want clarifying.
Yeah.
Okay, sorry.
So
if you could
part
just-
of it is, I'm gonna put on my social work hat and say I'm not a lawyer, and so part of it is law is looking into whether state regulations may interfere with that. So they're looking into that, but as far as I could say, yes, absolutely, we want to be able to pick up litter close to schools, and then also we want to be able to address some parks with playgrounds have directly asked us to come provide efforts and bring people into the drop-in center and other sources as well. So we want to be community responsive, and so those are the only things we're thinking about.
So maybe that's something we could look into in terms of clarifying the language of the bill too. And then because I remember when I was working at KCS, one of the campaigns we had worked on was not advertising cigarettes or nicotine or any of those things in bodegas or grocery stores or drugstores within a certain feet of schools, religious groups, and everything like that. So to me, it seemed interesting because I thought that this would be something similar. I could see what the challenges maybe could be, because on the positive side, if you're trying to do something in the community and there's a bill that's requiring you not to have any activity, period, I think that's maybe where we can sort of work on some of the language. If I'm just thinking out loud right now, so sorry. I just wanted to clear it up in my own head that trying to make sure I understand what you're saying. Okay. Oh, sorry. And Councilmember Mamrado, if you want to go ahead and ask your questions. Sorry.
Thank you, Chair. So do you have any plans to expand any of these programs, like the kiosk and like?
So one thing to notice that the kiosk program has expanded since it was started, and kiosks have been moved around when there's more of an issue at a different part or becomes no more issue at one park. So we definitely are doing a layering system where we're trying to layer on kiosks, we're layering on more education from the SSPs, and now we're doing the syringe redemption program because other cities saw that as so effective, and there was the great legislature put through on that. For the city, and so we're seeing it as a layered system. You want as many types of ways to do it as possible.
Great. Do you plan on consulting with a council member of the district before you expand in their districts?
Absolutely.
and
We're
community
already
boards?
talking with council members. Absolutely. We and people have been very receptive so far.
Okay, and I just don't understand how you cannot support the 450 rule. I mean, I think it should be over 1,000 feet. I don't know how you can condone drug use and not support children and children's safety. What measures are you going to put in place for these children that are in parks and at schools? Like, how could you, expose them to this? These are children. They're innocent.
Yeah, and so part of what we want to be doing by operating maybe near a playground is picking up syringes to keep them safe. So those are, I apologize because you had come in after we started talking about all the services that the syringe services programs provide, but a lot of what they do is do cleanup in communities when they send their outreach teams out. And so their main goal is to clean.
But you're saying it's also an exchange program.
Well, that's how syringe services programs work, is we hand out clean syringes.
So, okay, so
yeah.
since I came late because I was at another committee
Sorry
meeting,
about
so you're saying, no, you shouldn't be. So you're basically saying this 450-foot rule, you're going to be distributing syringes at parks as an exchange program.
Well, part of it is I defer to law because the state regulates the
And you think that
programs
this is
and
okay to distribute syringes by schools?
I mean, I have to look at it, that's not where the activities of handing out syringes are happening, that people don't. I think it's important to know that when someone's receiving these services, it's often an incredibly shameful moment in their lives. And when someone has a history of overdose and substance use, they may be using in a park because their mother lives with them at their apartment up the block and they don't want to show her. And so what we want to do is
But
provide.
then other children can see that, children who are not exposed to this,
No, so
and
what
that's
I'm
okay?
saying is I always move someone to where they feel comfortable and it's removed from people when I'm doing outreach, because I want them to have the dignity of privacy, even if it's on the street. So I'm not going to be doing it in a school. I'm going to be bringing them somewhere where they're comfortable. That's why it's so
You're
important.
putting children at risk for allowing this activity to even take place by their school. A school is a safe place. How can you support that?
I mean, I really have to defer to
Where's
law.
this data? Where is this data? Like, where's the data that allows this to be okay? Where can we find this?
I think it's a mischaracterization to say that the health department is trying to have people hand out syringes at schools. To be very honest, we're working to bring people into our services through contracted vendors and community providers, and the vast majority
Not
of
taking
the
responsibility, then, if you regulate this.
Well, the state regulates the programs, and so we're saying that we have to work with the state and law because the state determines where services are provided.
And where can we find the information that this data, this exchange program is successful?
I'd be happy to follow up. There's decades of research showing that it drastically reduces community spread of HIV, that it contributes to people safely disposing of their syringes and much more likely to engage in health services and ultimately find recovery and
What happened to don't do drugs and that message? I mean, it's not, I'm not trying to be funny. I mean, I've dealt with this. I have friends and family that have major issues, and you have to just stop doing drugs. I mean, just to like enable them is not really a key to success. I mean, it's sad and it's devastating to see people's lives being torn apart. And to think that to allow this around parks and schools and just like enabling this behavior is just, it's not okay.
And I can say that I'm sitting here today because I was given successful treatment decades ago.
Treatment, yes.
But that's what programs do, is they refer to treatment as well. And so it is long and complicated and deeply, deeply painful. But the reality is, and that's what we're seeing in the opioid crisis, that people often don't just stop using substances. They don't want to be many of the people who are using substances. They feel tremendous guilt and shame about it. And so what we need to do is engage them in a way that has dignity and respect so that we can get them to the care they need to have the life they want. That's why so many of the people working in SSPs have a history of substance use. That's why so many of us in the field are here today and alive, because we weren't told just stop and fix your life on your own. We were told how to get support and get to a better place.
Okay. And you had mentioned before about something about this exchange program, the syringe exchange program is going to help to provide more stable housing.
Yeah, we do make referrals to all sorts. Well, it doesn't provide stable housing, but referrals are a normal part. I mean, when I was doing mental health counseling, I was still doing lots of paperwork for getting people into housing, because I recognize you're not going to come for services if you're constantly moving to a different borough because you're unstably housed. And so that's just the normal part of our day, is connecting people to all the types of services people need.
I feel like I'm in like a alternate reality. Okay, I think I'm good. Thank you, Chair.
Okay, so, sorry, I'll follow up with a few questions and then hand it over for second round. In 2019, following an internal audit that revealed New York City Park staff, and this is something that Councilmember Marmotta was referring to with the kiosks, an internal audit that revealed New York City Parks staff were picking up close to 5,000 syringes a week over the course of one summer in the South Bronx. So this is back in 2019. DOHMH and New York City Parks partnered to provide, among other services, syringe disposal kiosks at 16 sites that represented more than 99% of syringes discarded in Bronx parks. So have those kiosks, are they still present in the parks? If so, why has this program not been expanded, or has it been expanded? If you could go a little bit more into the kiosks.
Yeah. So actually, we're really proud to say there's 21 kiosks in the Bronx, and there's 40 across the city. And I talk with parks every single week about how it's going. They talk constantly about, should we be moving it to a different location? Is there different signage that we should put on it so it's clearer how to use them? I know that we figure out things like, is there a different vendor that will need fewer fixes for a syringe kiosk over the course of the year? And so we're constantly working to refine the program, like you talked about before, and make sure it's still working.
And, okay, so there's 21 now, although I have to say, if there are 16 in 2019, do you think the 21 is accurate in terms of the reflection of the numbers we're seeing right now, or should we add more? And then also, how much is the total cost to purchase, install, and maintain one of those?
Yeah, I love those questions. So it costs $2,000 to purchase an outdoor kiosk and $300 for a restroom drop box. And so there's just going through it. It's all parks information. They were so lovely and shared with us. And Your other questions were, so we're trying to layer on other things as well because we are finding that people are using them. We also have more boxes that the state has helped the SSPs get, so there's many more opportunities to drop off. I think there was one other question. I'm so sorry, I forgot.
No, it's fine. I just wanted to know, because from 16 to 21, from 2019 to now, it doesn't seem like a huge jump. So just wanted to see if you feel like that's sufficient. Are there plans to expand it further beyond the 21?
Yeah, so I definitely defer to the city on plans for expansion and funding around that, but I do have to say that that's why we thought the layer on of the outreach teams was a good addition to the kiosks, because with a kiosk, you don't have any education opportunities, and you don't have an opportunity to bring someone over to the brick and mortar site. So we think that's a really key piece to it, and then we think the syringe redemption program will ultimately get a lot more people engaged in these services, and then having safe opportunities for disposal as well.
Okay, perfect. Round two questions, Councilmember Felice, if you want to. Councilmember Mealy, do you have any questions? Sorry. Okay, sure, go ahead.
Hi, great question, my colleague. These vendors, they from the city, right? So the city purchased them and then they sit out and they have the authorization to move them around?
Oh, so the SSPs, which are our syringe services programs, have been around since the 90s, and both the state regulates them. And it's a lot like a hospital is how I think about it. Like the state regulates the hospital, and the city also has funding and oversight of them as well. And so they operate many kiosks. They partner with parks.
So you said they have the oversight. So who make the decision where these vendors?
That's where the partnership is so important, because we're meeting with parks, and they can, because they have their workers right there, they can tell us, hey, your outreach team needs to do another walkthrough in this park each day, or so the park staff, let me follow up with parks and make sure I'm getting right who actually fixes which kiosk, because some of them are fixed by the SSPs, some of them are fixed by parks, but that's why we're all meeting on a regular basis to make sure that they are up and running.
Is the community involved in this?
Oh, the nonprofits are all community benefits organizations. They're all CBOs that are, many of them were started by community members who were noticing the huge impact of HIV on their communities and wanted to start their own services. So then they worked with the state, become licensed, and that's how these organizations
Could you
work.
I want to know who makes the decisions to move them to different areas?
I'll follow up.
Okay. Because it's important, because some people may not want it in their park. So what kind of outreach have you seen any resistance?
Wait, sorry, can I ask a clarifying question? Do you mean the kiosks or the actual services provided?
kiosks.
Okay, the kiosks
Oh.
she's talking about. That's why I was like, I think there's a.
Thank
Yeah,
you.
yeah.
Thank you so much. So no, we're not seeing pushback from the communities, because
Not at all.
when there continues to be a problem with syringes, we hear complaints that the kiosks are not working, and so that's why we then send our outreach teams to do cleanup, to get people engaged in services.
So how is the cleanup? What kind of training they have in regards to these needles?
Yeah.
And I'm sorry, I had to take another meeting. You say that y'all have training to pick up these sharp needles. If something go wrong, what's the outcome of it? If someone get pricked with a HIV needle while they are in training, picking up these syringes?
Yeah, then people get immediate access to medication if there's pricks. But what we're finding from...
Who is that on? Is that on the Parks Department or the vendor?
No, they get in touch with their local hospital. So we have this, there are federal regulations for how to safely pick up, or I think it's CDC regulations for how to pick up safe syringes. We do trainings with people. We find very, very few people even ever get injured. And then just like all OSHA safety at a workplace, if you are potentially going to be exposed to any substances. I know I've taken tons of trainings about who to call, what number to call, and how to get immediate access to free medication so that I don't get an infection.
So these not city employees, because I heard it was training.
There's a combination. So there are Parks Department staff who are doing this, there are sanitation staff,
minute.
and there's community
Parks
providers.
Department staff is picking up waste well, not waste, but syringes, and they are not getting paid the proper salary anyway. And now the Parks Department has put that task on them to train to pick up syringes.
As a health department employee, I definitely don't want to speak for the Parks Department, so can absolutely have them follow up with any questions that come up.
But do you feel Parks Department staff is not really making that much money? Are they getting hazardous pay?
I definitely can't speak to any of them. I'm so sorry. I just don't work for the Parks Department.
That is so important, because that's not fair to the trainees, and it should be a price, just a hazard, taking up hazardous material. That should be the law.
And that's something we can follow up with all the city agencies that are involved in that. so-
Please do, thank you.
Okay. Councilmember Felice? if you wanna-
Thank you. I'll ask a brief follow-up question on the line of questions that Councilmember Millie mentioned. So yes, Parks Department shouldn't be picking up syringes. Generally, Parks Department employees are generally there for general park stuff. They're not health experts. They shouldn't be picking up syringes. But given the fact that the Department of Health and providers who are experts and professionals on the issue not willing to do their part, Parks Department people are being forced to allocate resources and pick up syringes. Because of course the Parks Department is not there just to have a park, but to make sure that people could actually use it, and a park and a children's playground filled with syringes cannot be used by the community. So I just want to make that point clear. Parks Department, nobody would want to pick up, they shouldn't be picking up syringes, but they're being forced because the Department of Health and the providers have implemented this program in a very incompetent, sloppy way. I mean, if hundreds of needles are ending up in a children's playground, I can't think of better words to describe that. Earlier, you mentioned many good things about the program, that they do refer people to treatment. These are, I think everybody here agrees that these programs are really important programs. People that need help deserve to be treated with compassion, and they deserve to receive the services that they deserve. Great program. I think there's no dispute about that. But no one is questioning how good or bad the program is in general. What we're questioning or what we're proposing is basic standards so that these needles do not end up in a children's playground, places that should be safe for innocent people. So a few questions about the 450 feet rule. I think they were somewhat asked earlier. Just in general, do we think it's a good idea to provide hundreds of needles right in front of an elementary school?
No, and that's not happening. So I do have to be honest about that. The bulk of the work around a school is going to be cleaning up. It's going to, like I said before, and I know we keep going over this because it feels like we're not giving enough it's not fixed yet, and so it continues to be an issue. But what we're doing is helping someone come in for services. That's the whole point, and cleaning up syringes. And so there's no kid who needs SSP services. And so our focus is getting out into the community to clean up and get people connected.
All right, so that question was about schools. Do we think it's a good idea to give syringes right next to a children's playground? Same answer?
Again, the focus remains the same. It's about getting someone connected and cleaning up. People tend, again, you tend to bring someone to where there's more. I worked on the Be Heard teams, I worked on outreach, I've partnered with DHS, and you always try to bring someone to where they're comfortable. And people aren't comfortable in playgrounds, and so we're trying to work to get them to come in for services.
All right, but yes or no, very simple question. Do we think it's a good idea to give out syringes right next to a children's playground? Yes or no?
And again, I have to defer to state regulation about how
What's the
syringes are handled.
DOH's position on that? Obviously, the state people have their own administration. What's the city's position on giving out needles not 100 feet away, right next to a children's playground? Do you have any position, any general principles that we could agree on that issue?
I mean, I think we're getting into, what if someone says, I need a clean syringe, and you say, okay, and you hand it to them, and then you walk them over? I mean, that Technically, but that's not, I mean, I just don't feel that we can answer the question, because I think you're trying to get me to say a specific answer, when I'm trying to say it's much more complicated, and the relationship you form through outreach is more than just handing out a syringe. It takes place over time. You give them a receptacle at the same time. Maybe you hand a syringe and then go walk them over to the kiosk as well.
All right, so I guess the question, I'll make it a little bit more pointed. Do we think it's a good idea to park a mobile distribution truck right next to a children's playground, a truck that provides needles? Yes or no? That's a very simple, clear question. If we could just get a yes or no on that, that'll be great.
But what if
Yes
it's
or
a
no,
park that has...
Is it okay to have a
sorry.
mobile truck giving out needles right next to a children's playground? That's a very simple question, and if you cannot answer that, I'm very concerned about many things related to health in our city.
It's a simple question that doesn't, again, talk about what the full scope of services are. And so if there's a park that is seeing hundreds of syringes, and it's a park where adults are as well, and there's a playground there that's experienced syringe issue, and you have a mobile van parked there to get people registered for care, to get people registered for services, and part of the state regulation is if they ask for a syringe, you both teach them how to safely give it back, and you can take it back yourself, because they can hand it right back to you when they're done. That provides an opportunity for safety for the community and the children trying to access the playground.
Well, I guess for anyone who's interested in getting the answer to that, the answer is, I would assume it's a no. For the Department of Health, it is okay to have a mobile distribution truck 1 feet away from a children's playground. And you're saying no, but for those who are interested in getting the real answer, just Google Maps 532 East Tremont Avenue. You'll see a mobile truck providing needles 1 feet away from a children's playground. There's one word for that: irresponsible. And if something happens to those children, they should be able to sue all of you in your personal and official capacity for your negligence. My time is up. Thank you.
Okay. I think yeah. Okay, go ahead.
Thank you. Thank you so much. So you stated about, first it sounds like you're luring people to these vans with free syringes in order to give them education. Shouldn't you just be focusing on the services and education? Because that's what my office does. And we're not giving them anything to come there. They're coming there on their own free time. And if they need help and they really want the help, they are coming to my offices. So it sounds a little bit off to me. And also about the distribution of the needles in front of schools, you said it's not fixed. Those were your words. But it's your job to fix this. This is what your job is, to make it appropriate. I mean, you have to work on these things. You can't just say, oh, well, this is the current system. And that's just not an acceptable answer.
And I absolutely, the health department is not saying it's fixed.
You just said it. Well, you're saying it's not fixed, but you need to fix it. You need to focus on that.
But that's why we come to work every day, and that's why I'm meeting with the community providers, I'm meeting with community boards, I'm going out doing outreach sometimes too, and working with the teams of community members. And so I definitely have to lean on decades of research saying that SSPs don't increase drug use, they don't increase overdose, and they reduce the community spread of infectious diseases and
so
overdoses.
before my time is up, I just want to hit, are there currently sharp boxes in parks, in the bathrooms of parks?
Those are the kiosks so that
Okay.
people can safely dispose of it.
Do you have any data as to where they are currently located in which parks? Because I'm going to start walking around to my parks, and if I find any of them in my parks, it's going to be a big problem. This is not welcome in District 13. We don't enable people, okay? And I would like that immediately. I'd like somebody to send that information to my office immediately.
We'll follow up with parks, thank you.
Okay, and I'm done. Thank you.
Okay. I think we're going to move on to public testimony soon, but before I do that, I just want to, how do I say? I think this is a very complicated issue. I actually think that as a social worker, the mantra always is you got to meet people where they are. So I understand what you guys are saying. I understand that there's a lot of concerns, which obviously you're hearing today, which hopefully you can come back to us with some of those answers. But I will also say that This is a huge issue and crisis that I know that you guys, no offense to you, are not going to fix by yourselves, right? It cannot be done by you alone. And this is a community-wide issue. I know that it is also an issue that is very hidden in a lot of communities, and there is a ton of stigma, which is why, you know, and I gotta say, I'm more than welcome. I have visited some of these SSPs, and I highly encourage my colleagues to visit and actually see what they're doing, because it's very different to read about it on paper and then actually see what it is that they're doing. And so I would be more than happy to go with any of you guys if you're willing to, and ask a lot of the questions that we have, because I do think that in the past, when these SSPs come up, there have been a lot of concerns from the neighborhoods actually, right, where they are. But I think that's where we need to make sure that the community voices, folks from the community board, folks from the schools, folks from, you know, NYPD and all the other folks that are very much involved in how these sites are run, how they actually operate in the community and see it versus hearing about it, so.
But I did ask that. She
Yeah.
said it's no pushback on it. Did you not say?
Oh, no, that was for the kiosks, if I'm understanding correctly, yeah, the kiosks, not the SSPs, that's different.
So I
but-
gotta look at that.
Yeah, no, and I highly encourage, because I have to say, you know, and I know that all of us have different views and thoughts on this, rightfully so. It's not an easy issue, but I'm hoping that what you're hearing today is a different viewpoints, which I think is important to take back, right? Is that you want to hear from a broad sort of spectrum of voices and concerns, and hopefully what we can do then is take that back and then translate that into stronger programs and, you know, what we need in the community. So I want to just thank my colleagues here, because I think their concerns are very legitimate, and I just hope that we can address this issue together. So thank you.
Thank you.
Are we moving into, yes. Okay, so with that, if you guys can stay, if anyone from DOHMH can stay, I want to move this into public testimony, and remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members from the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant at Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card, if you have not done so already, with the Sergeant at Arms, and wait to be recognized. When recognized, you will have 3 minutes to speak on Introductions 868, 1169, or Resolution 317, which is my resolution that we actually haven't talked about at all, but hopefully someone will talk about that. If you have written testimony or statement or anything additional you wish to submit for the record, please provide a copy of that testimony to the Sergeant at Arms, and you may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing, and I promise you, the committee staff, they read every single word of your testimonies that you submit. So I just want to reiterate that. So with that, let me just give a minute for folks to transition in and out. Goodbye to the high school students. I know you have to go. Oh, another hearing. Great. You guys are making the best use of your time and day, so that's awesome. Which one? Okay. Okay, so I'm going to call the first panel, and I just want to apologize ahead of time if I'm mispronouncing anyone's names. First, we have Christine Kiken. Am I saying that correctly? Are you here? Jacob Clary, Elliot Thompson, and Jasmine Budnella? Is that Budnella. So feel free to come up to the table. Oh, thank you. So you all have 3 minutes. I may stop you guys at the 3 minutes, but I'll, of course, let you guys wrap up if you go over the 3 minutes. But when you hear the buzzer, you can wrap up, if you will. So feel free to go in. You guys can go in any order you want. Christine, do you want to go first? Or actually, do you want to? Yeah, you can start from this side. Okay, go ahead.
Thank you. My name is Jacob Clary. I'm a harm reduction counselor at Housing Works, where we work tirelessly to provide safe syringe access since 1993. Housing Works opposes the passage of Intro 868 and Intro 1169 as unnecessary and detrimental to the effective operation of syringe service programs. The proposed initiatives are redundant to existing practices, guidance, and trainings that are enforced and monitored by the New York State and City Departments of Health. Moreover, they will interfere with existing collaborations between schools and community groups and harm reduction organizations. While we recognize the Council's concerns, we hold that they are based on unfounded claims that these programs promote drug use, crime, and syringe litter. In fact, decades of research support the role of harm reduction in addressing problematic drug use and syringe waste. Intro 868 will not prevent participants from taking clean syringes to any location in a neighborhood, but will instead limit the safe distribution and disposal efforts. The focus of this bill is simply not aligned with the mission, practices, or experience of syringe services programs. Likewise, Intro 1169 is redundant to guidance from the DOH, which provides education to participants for safe disposal of syringes. A list of syringe access programs on the New York City and State Department of Health websites can be accessed to support communities, parks, and schools in syringe disposal. Instead of imposing new restrictions, we should be placing more secure kiosks and containers in areas where they are needed most. Every syringe service program, including ours, has safe disposal containers on site, and ours and other programs work closely with the DOH to install and maintain syringe disposal kiosks in high-need areas. This effort can and should be expanded, but this is not accomplished by passing new laws that only give the false impression of progress. The solution is not mandated restrictions on syringe access, but building community partnerships which can foster understanding and communication, and crucially, to allow and fully fund overdose prevention centers, which allow substance use to happen in a controlled environment where used syringes and other drug use supplies can be disposed of properly. I'm happy to answer any questions.
Wow, you're under time. Good for you. Usually people go.
Let me finish then.
Yeah. No, you should use up your 3 minutes. Go ahead. Yeah.
Okay. I just want to note that after grilling the representative from the Department of Health, the two representatives that were asking about community services left. The community services are sitting here at this table, and I take personal and professional offense to that.
Thank you. Go ahead.
Hi, and thank you to the committee. My name is Christine Kuiken. I'm an attorney with the Legal Action Center. For over 50 years, the Legal Action Center has been using legal and policy approaches to fight discrimination, build health equity for those living with substance use disorders and HIV or AIDS. We fight to create affordable and equitable access to quality treatment and harm reduction services in New York and nationally. And so I'm here today because we are deeply concerned about the two bills at issue, 868 and 1169, and we oppose. We understand the goals to address reports of increased syringe litter. We believe these two bills are extremely overbroad, not narrowly tailored, and will lead to dangerous unintended consequences, and may even actually lead to more syringe litter, which would undermine the entire purpose. And further, one-to-one exchanges have proved to be ineffective and even dangerous. Both of these bills, by creating new and onerous restrictions, create increased opportunity for surveillance of both the programs and their participants, which time and again has only moved these services underground, discouraging participation for fear of criminalization and reducing their overwhelming effectiveness at reducing HIV, Hep B and C, and overdose rates. For 868, I don't have a map in front of me, but it's undeniable that many neighborhoods are obviously dense with playgrounds and parks, making it near impossible for mobile providers to distribute syringes where they are needed most. And the second bill, 1169, is similarly concerning creating overwhelming administrative burdens, onerous data collection requirements, and opportunities again for surveillance and potential liability. Again, and also the public reporting that focuses solely on syringe collection volume ignores highlighting the important successes of these programs and can even create more stigma in neighborhoods that are, because of, showing that they are failing at collecting the right amount of needles. Overdose deaths for Black and Latino individuals are not showing signs of abating. Right now, it's incumbent on the council and the city to commit to resourcing SSPs. The only way to solve these apparent issues is to foster trust, partnership, and with the participants and the community. Thank you so much.
Good morning. You can hear me okay? Awesome. My name is Jasmine Bunnell, and I'm the Director of Drug Policy at Vocal New York. I wanted to start off by thanking you all for allowing me this moment to testify. This thanks comes not just from me, but from our staff at our syringe service program, our participants, and our members and leaders, and from the countless that we have lost over the last year. Vocal New York was founded by AIDS activists who refused to wait for permission to save lives. They built underground syringe exchange programs because policymakers refused to act. The same programs that has since become the gold standard for public health for people who use drugs. For nearly 2 decades, we've been providing harm reduction services in Brooklyn. It is not lost on us, but seems to be lost on some, that as the federal government is considering gutting Medicaid, a critical healthcare for the people that we serve, the bills before this council will chip away at another healthcare system for people who use drugs. What is being proposed will take us backwards and force the most vulnerable into shadows and have real health impacts. We are urging the council to lead and reject these bills. Intro 868 will make it harder for us to reach the people who need the services the most. As Christine said, in a city as densely packed as New York, where public spaces and schools are everywhere, this would severely limit our ability of where we can operate. In many neighborhoods, it would make it nearly illegal for us to operate. Mobile syringe service programs exist because many people experiencing homelessness and drug use can't easily access brick and mortar locations. Community members, elected officials, and agencies often ask us to go to hotspots in the city to serve these areas. The city can't, on the one hand, or this bill, on the one hand, tell us that we need to go clean up and service certain areas and ban us from doing so. Our services are much more than providing sterile supplies. At all of our outreach locations, we do syringe cleanup within 2-block radius. And just last week, one of our participants voiced that they were ready for treatment, and we were able to connect them to detox before we left that location. Homeless encampment sweeps have increasingly become a barrier to our services. We lose contact with many of our participants, which means not being able to provide them with care, sometimes only reuniting them with them when a new hotspot emerges, and we cannot stress enough that housing is a critical piece of this dynamic. Not to mention, for homeless New Yorkers, overdose is the leading cause of death. Our mobile services are underfunded and understaffed. Instead of limiting proven public health solutions, the city must invest in expanding mobile services in the Department of Health. I just want to really quick highlight on the second bill. Requiring public tracking of the number of syringes versus collected in and out is not a public health strategy. It's red tape made to make harm reduction harder. I wanted to give you the stats of our successes of our program just very quickly. Outside of just providing syringes, we got 18 participants into a safe haven this year, 9 from shelters in safe haven into permanent housing, 16 enrolled in buprenorphine, 9 enrolled in hepatitis C care and treatment, and one of our participants just enrolled to college. One big thing, one-to-one exchange, the Intro 1169 creates a precedent for one-to-one exchange, which New York has long abandoned. This decreases trust, increases barriers in the likelihood of reusing and sharing syringes, inevitably increasing the risk of hepatitis C and HIV transmissions, abscesses that can lead to amputations and blood infections. Studies have continuously shown that needs-based distribution is the way to go. In fact, outside of studies, the WHO, the CDC, the United Nations, the New York State Department of Health all recommend needs-based distribution. As our social safety nets across the country and here in New York are deeply at risk of being cut, we cannot allow more barriers to us being able to provide care and save lives. Thank you for letting me go over time.
Good morning, Mental Health, Disabilities, and Addiction Committee members. My name is Elliot Thompson, and I am the Outreach Coordinator, and I run the Syringe Exchange at the Alliance LES Harm Reduction Center. We're a care management and harm reduction nonprofit that has helped tens of thousands of New Yorkers since 1991, and I'm here to give my strong opposition to two proposed bills, Intro 868 and 1169, that I believe would increase infections and fatal overdoses in New York City. Harm reduction means using evidence-based approaches to reduce the personal and systemic harms associated with drug use. It means meeting people where they are with compassion and respect. I do outreach in our community, mainly in public parks, distributing sterile syringes, sharps containers like this one, Narcan, as well as medical supplies, socks, food, and other necessities to people that need them. This work is twofold. One, it helps an immediate critical need, and two, it builds relationships with our participants so they will trust us and come to our center to receive more services. This approach is not enabling. On the contrary, according to the CDC, people who use SSPs like ours are upwards of 5 times more likely to receive treatment for their substance use and upwards of 3 times more likely to reduce or stop injecting drugs. Narcan distributed by us was used at least 53 times to reverse overdoses last year, and that is just from people who reported it back to us. Our work saves lives and it gets results. It is to protect our work that I oppose Intro 868, prohibiting the distributions of hypodermic needles by mobile syringe service programs within 450 feet of schools and playgrounds. I presume this bill is intended to keep people who use drugs away from kids, but I assure you our participants are not interested in interacting with kids. Many of them are experiencing homelessness, and public parks, which are often near playgrounds and often near schools, are some of the only places they can go without feeling like they're being hassled or feeling like they're in other people's way. Essentially, this bill makes being homeless illegal in the only places we've allowed the homeless to be. This bill is morally cruel, but it's also impractical, because to help someone, you have to be able to find them. Our people are in parks, we know they're there. They're not trying to coerce or interact with children, they're looking for a safe place to be. I oppose this bill because it would cause the increased persecution and harassment. I oppose the bill because the life-saving work of distributing harm reduction supplies, including syringes, should not be restricted to areas far from parks and schools. If you're worried about syringe litter, help us pick it up. Don't criminalize the existence of an already precarious population. I also oppose Intro 1169, safe collection and disposal of needles and syringes. I oppose this bill because it invites an unacceptable risk of accidental syringe contamination or needle sticks. At our Harm Reduction Center, we collect syringes in large sharps containers and pay a specialty company to collect them safely when full. We also distribute personal sharps containers to our participants like this one. These containers prevent infections and should be everywhere. We fully support a DOHMH database cataloging large sharps containers in every neighborhood. We hope the city will fund the installation and collection of these like community trash and recycling bins. We appreciate the good intentions of the bill, but object to requiring harm reduction centers to provide disposable receptacles in each program location in areas that are publicly accessible at all times. Our system works. Participants ask us for personal sharps containers and return them to us for us to dispose of. We build trust with our participants, and the system prevents people from absent-mindedly taking out their used syringes. Instead, we ask the city fund additional large sharps containers and more small containers for personal use. Please vote no on Bills 868 and 1169. Thank you.
Thank you so much. I have questions for you guys. And this is the reason why we have these hearings, right? Is that we're not taking a vote yet. We're introducing it, talking about it in the hearing so that we can figure out what changes need to be made, what legislation, like language amendments need to be made. So I'd be curious to hear from each of you, and you don't have to answer this now, but if you could if maybe you want to resubmit or add this in your testimonies, because you guys are working on the ground and know things, you see things that are happening on the ground. And so I'd be curious to hear from you all on the two bills, knowing that there are concerns that the community has, how you would maybe amend some of the language of the bills to not only address the concerns, but also moving forward, what would your suggestions be for how to make improvements? Because what I will say is that even if it's outside of the purview of the bill, I'd be curious to hear what you guys have to say in terms of what we're not doing, what we're missing as a city, how we can make improvements. So feel free to answer now. And then also specifically for Jasmine, I was just wondering, or actually any of you, for the mobile programs, do you also partner with IMT, ICT, the AOT programs, as well as Be Heard and all of the other ones that are out there? Because oftentimes I find that they're not connecting with folks, perhaps like yourself. And so I'd be curious to hear what your experiences have been in connecting with those other outreach teams.
Yeah, I'll start on the outreach, and then maybe we can mention a little bit about the bill. Our outreach program is called Peer Delivered Syringe Exchange, which is through our syringe service program. We know that peers on the ground are the best people to connect, as you're mentioning with other outreach programs. As you all might know, Vocal New York is also an organizing shop, and we've long called on more collaboration between city agencies on these multiple crises of homelessness, of substance use, and mental health. We need collaboration because what is happening is each different piece is being addressed differently. Our peer delivered syringe service program is really rooted in just trying to get people into care. Often, though, I will mention, as it was mentioned earlier by the Department of Health, some of the areas that we're covering are pretty far from our brick and mortar, and so we need to continue providing that care there. I will mention that the city also has a HEAT team, and I know that there's been some complications with that, but we have partnered with HEAT teams in the past. Sorry, the last part on the bill, the two bills, I'm also a supervisor, and sometimes I'm often asking, what are we trying to solve? And so I think that instead of legislating, what you're attempting to do here is we're trying to solve multiple crises at the same time. We're trying to solve homelessness, we're trying to solve syringe litter, we're trying to solve the overdose crisis, and so I think that requires collaboration. I love that you mentioned community is really critical, that we're having conversations with community agencies, elected officials at both the council level, the city and the state, which I know that there's been some amazing champions here. So I think legislating our way out of this is actually more harmful than us being able to roll up our sleeves, get in community, and have conversations.
No, I hear you on that, because oftentimes I remember being on your side of the aisle, and a lot of bills are well-intentioned. Sometimes in terms of the implementation as well as the execution phase, there needs to be more thought out there. So these are just, again, early stages of us considering these bills and figuring out what maybe some of the potential roadblocks and challenges could be, and how to also address the concerns. So I appreciate all of your perspectives, and if any of you wanted to jump in, if not, feel free to resubmit the written testimony piece. Yes, and you can email Sarah directly. I swear to God, these amazing staff read every single word of the testimonies, and oftentimes it does give us a lot of ideas about how we sort of relook at things. So I appreciate all of you and your work. And Housing Works does have a program in my district, which I'm very thankful for. So thank you. Go ahead.
I just wanted to add something.
Yeah.
Oh, go ahead, please. Okay. I think the issue is that these bills are talking about a symptom, and they're really trying to nibble around the edges when we need wholesale change. I mentioned overdose prevention centers in my testimony, and I just want to double down on that. When we limit access to syringes, we don't stop people from using drugs. We stop them from using drugs safely. Every HIV infection, every hepatitis C and B infection is a policy failure. We know what works. And what works is syringe exchange, and even further than that, what works is overdose prevention centers. If you want syringes off the street, give people a place to use safely.
And I've been to a couple of the OPC sites, and they're doing a lot of great work. So, Councilmember Mealy?
Oh, yes, I just heard that the sweeps, I thought the city have stopped doing sweeps like that at tents.
No.
So you telling me the police come in like Central Park, and if someone is living there for a minute, they sweep them and sometime even arrest them also, right? And then it takes you longer to find those same individuals again, and you have to start all over. And if they just happen to go now to Brooklyn, you lost that individual to, even if they were making progress. So the sweeps are still going on. That is concerning. I didn't know that was still going on. So we should be addressing that just as well. Do they have any reason why? Just they say they loitering or something? Because as I heard the testimonies, that's people's safe place to, if they want to shoot up, they do it there because they feel kind of safe. So what is the reason why the sweeps? Do anyone know why the police are doing the sweeps?
I mean, this administration, Mayor Adams has been pretty aggressive at sweeping homeless encampments. And so not only are we losing them in contact with them, you're right, some folks are making progress. It's also like incredibly, we've been in certain locations for years, so we're building long-time relationships, but people are also losing their documentation. People are losing, you know, things that they've, pictures of their families. It's inhumane and brutal and very, very disruptive in people's lives. And the administration is continuing to do sweeps.
I thank you for that. I didn't know they were still going on. So that's something I would look into. Thank you. We need that.
Thank you all.
Thank you.
Thank you so much, especially for the work you do. Thank you. Okay, next in-person panel is Keisha Candinedo, I'm sorry. Jason Candinedo, Timothy Carlos Major, Araki Brown, and Sharon Leslie Brown. Okay, and we can start from here if you want to go first. And just make sure the...
Is that it? Yes. Okay. Hi, good. Sure. Okay. Hi, good morning. My name is Keisha Candinedo. I am from a park group called Friends of Echo Park in the Bronx. And I just wanted to share something. I understand where a lot of people are coming from, you know, in terms of why they want to do this bill. I get it. I, at one time, felt very similar about drug use and feeling like a lot of these harm reduction services was just another form of enabling people. But when I've seen the work of two groups in particular that work in Echo Park, one is On Point, NYC, and the other one is St. Anne's Corner of Harm Reduction. And I see what they're doing in terms of the services with the vans in the park, how they're picking up most, if not all of the needles in the park so that the Parks Department doesn't have to do it. When I see that they're offering services to the people in the park to come to their facilities, to get the wraparound services that they need, it definitely changed my mindset about these harm reduction services. And so I feel like they are vital to our community. We need them because without them, we're gonna see a whole mess of needles all over, and not just in the park, around the streets, around the neighborhood. Yes, there's a school down the block, but I'm gonna tell you, these kids, they're not dumb. They know what's happening in the street. We're not hiding anything from them. They know what's happening. But if they see efforts of groups like On Point, like Satcher, that are trying to help people, I agree with you, where they're at and moving them forward, out of addiction, then that's a positive thing for them to witness, because otherwise they're just going to see the harsh, dark reality of these situations with these people that don't change. I want to read something from a Daily News article. It was written in 1971. And this is from Nixon's Domestic Affairs Assistant, John Ehrlichman, I don't know if I'm saying it correctly, about the war on drugs. He says, "We know we couldn't make it illegal to be either against the war or blacks, but by getting the public to associate the hippies with marijuana and blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. Did we know we were lying about the drugs? Of course we did." This is from 1971. This war on drugs has been going on for 54 years. And it hasn't just been a war on drugs, it's been a war on communities of color to disrupt, to dismantle, and to destroy through drugs. Okay, no matter how you slice it, that's exactly what's been happening for 54 years. This has been a form of genocide and extermination. So traditional forms of treating drugs has obviously not worked. So if we see alternative ways of helping people not to stay in their drug use, but to move from it, forward, onward, this is what these groups are doing. So to stop their work now is not only going to make the situation worse for people who are struggling in addiction, it is going to greatly affect the communities where these people live. So I am asking that you guys oppose, do not pass this bill, because it's going to be bad for all of us, as it has been for the past 54 years. Thank you so much.
Hello, good afternoon. I'd like to read a statement. My name is Jason Candanito. I am a Bronx resident who currently resides in the Tremont section of the Bronx, and I am also a member of the community group Friends of Echo Park. We are the constituents of Councilmember Felice. I am here to voice my position to Bill Intro 0868 on the following grounds. The reality is that people use substances in New York City public parking spaces. As an active participant in a local parking organization in the Bronx, I've witnessed this firsthand. I've also witnessed the great work that organizations such as On Point New York City and St. Anne's Corner of Harm Reduction have done in these parks to address and alleviate these issues. This bill erroneously implies that these organizations are the cause of harm, which is blatantly false, as due to their syringe programs, HIV and HCV infections from sterilized syringes have fallen drastically. Banning these programs from these spaces will curtail the vital services that those with substance use disorder need access to, as these programs offer a myriad of services and resources on site. This bill, if passed, has the potential of inflicting irreparable harm to those people who are most vulnerable and need services the most. Banning and prohibitions, more often than not, are ineffective. What is effective are the life-saving services these programs provide. Here are the facts. According to Health Department data, in just last year alone, outreach and syringe litter teams collected more than 187,000 ground syringes and provided syringe disposal education more than 600-800 times. Plus, according to years of research by the National Institutes of Health, syringe exchange programs are not a major source of pollution, and people who get needles from an exchange are more likely to dispose of them properly than those who do not. According to the same data, the healthcare risks associated with improperly discarded needles are minuscule. The healthcare risks posed by a discarded needle are not on par with the healthcare risks posed by banning services. We are not here to lay blame or fault, but instead to seek solutions. And this bill is clearly not the solution. Thank you.
Hello, can you hear me? Dear esteemed members of the committee, my name is Timothy Carlos Mayor. I'm a professional in public health, the CEO of St. Anne's Corner of Harm Reduction. Thank you for your kind words. A South Bronx institution for over 35 years, and also a proud New Yorker. I'm speaking today to express my strong opposition to Intro 868, the bill prohibiting syringe services within 450 feet of a school or a playground. If enacted, Intro 868 would negatively impact my agency and similar agencies' abilities to deliver services like this and other life-saving interventions to folks in need, especially at a time when our city's rates of disease and overdose are on the rise. I think I speak for everyone when I say that we are all in favor of safer communities, especially safer schools, but by prohibiting syringe services, you'll be contributing to the problem. Simply put, by making our services harder to reach and access, you'll only serve to hurt our neighbors and further the city's health challenges. My agency, along with many others that spoke today, provides syringe cleanup up to 7 days a week with hotlines to report syringe litter, amongst many other services we provide. Our mobile outreach units deliver holistic treatments and services in collaboration with our harm reduction work. By preventing our mobile syringe exchange, you're preventing our participants from accessing the plethora of other services we have available, thus denying someone an opportunity at doing more for their health. Should the bill pass, where will our outreach units go? In the Bronx, for example, where we work, the majority of locations that are not within 450 feet, let alone 1,000 feet, as one of the members mentioned, are mostly in the highest earning zip codes, their districts. If we are forced to move our operations to locations that meet the requirements of this bill, we will be forcing our services into communities that are not in need of our services compared to areas like the South Bronx. By pushing us into the corners of our boroughs, the problem won't disappear. The communities that are currently handling these challenges will not see any relief because the people who require these services have nowhere to reach us. I'm going to give the benefit of the doubt and say that this piece of legislation comes from a good place, the desire for safer boroughs. That is the purpose of my nonprofit. With this in mind, I propose we broaden our view of this current challenge and lean on our strengths. Let's set up collaborations between local syringe providers and city departments to establish training protocols, listening sessions, equitable schedules to address every part of the city's syringe litter challenges, combat stigma amongst our institutions, and of course, create a safer city for all of us. We're actively communicating with schools to provide trainings and meetings to help parents, teachers, students, and others understand the current challenge and how we all can do more. Let the SSPs do the work they're good at. Expand our funding so we could expand our syringe cleanup efforts across the board, for example. When we ask why our people are in parks and playgrounds, we should be asking, why are they seeking these spaces? Why are our shelters not safe for those in need? We could be doing more for our people by establishing more safe spaces like drop-ins, community centers for our people, rather than destroying what they have left and forcing them into the shadows. I am proof that harm reduction strategies work. I was raised in the loving arms of this community. These are real people, real neighbors, real voters that we are talking about. Therefore, our strategy should be equitable and support everyone, not exile a population of our people to a corner of this borough to be forgotten about. For these reasons, I urge you to oppose Intro 868. I appreciate the opportunity to provide testimony, and I hope you will consider the harmful implications of this bill. Thank you.
Yes, good afternoon. My name is Irachi Brown. I'm from the Bronx, Community Board 5. The testimony, I believe, for this bill here, 0868, needs to be dismissed. The local law amendment to prohibit distribution of hypodermic syringes and needles by mobile service programs. What we have here is a failure to recognize fear, the idea that fear can be paralyzing and prevents people from taking chances to make changes, standing by action until completion, which will produce a concrete positive outcome for our residents and our communities. We can accomplish great things if we look at the problems face on, rather than being held back by lack of knowledge, doubt, and fear. Addressing this bill prohibits the distribution of hypodermic syringe and needles by the mobile syringe service program within 450 feet of schools and playground. What it does, it prevents serving the community, which serving the community means being out in the community. We have outreach and public safety teams such as OPST, which serves the individual in East Harlem, Washington Heights, and the Bronx. All connecting comprehensive programs to provide the basic needs such as food, clothing, safe for drug use supplies, and educational materials, as well as addressing syringe litter and other hazardous waste. Community kiosks and mobile units is a collaborative effort between the Parks Department, the Department of Health, and On Point NYC, which aims at addressing public health concerns related to substance use. The initiative requires the installation of syringe drop box in high impact areas, specifically in public spaces, which has a known history of drug use. As far as public schools, the OPS team reaches out to the neighboring schools and offer them these tools and services to reduce the risk of needle stick injury, support safer environments, reinforce harm reduction principle, and commitment in promoting safety and cleanliness. Rather than limiting the work that these harm reduction organizations do, we should be talking about making sure that they get additional funding so that they can continue to provide the services and expand on them. That is the goal we all should be striving for, not localizing specific points and nitpicking on semantic, which always results in some type of verbal delusions. For example, NYPD is not the solution in solving this dilemma. They cannot do all of it. This crisis of substance abuse is much larger than we can even imagine. Limiting the work of the harm reduction services play a much bigger strain on the NYPD, not to mention the amount of dollars and manpower needed to attempt to resolve this problem. The NYPD already has hundreds of matters to tend within our community. We need more mental health and addiction services professionals during this work, like one of these programs provided. They say it takes a village to raise our children. The standards which our democracy imbues and guarantees our right as free-thinking citizens to thrive in the land of freedom, our country, America. Let us not leave out the foresting of trust in building a greater community by helping to create a more livable and welcoming environment for everyone that lives here. Prohibiting the distribution of syringe and needles service around the public school area, I feel, should be negotiated between the schools in questions and the outreach personnel involved. Our children are faced every day seeing community members using these drug abuse firsthand. You have drug dealers and substance selling their wares around school children at school. Yet I see no one outcrying to stop these actions of illegal sales. Yet you would punish the very people who are trying to offer a solution to the problem. The amendment to me, if you are not a part of the problem, then you must be a part of the solution. Let us not negotiate out of fear. Let's both sides explore what problems unite us instead of belaboring those problems which divide us.
Thank you.
Hello, my name is Sharon Brown from Rose of Sharon Enterprises. Before I start, remember the hostages, release the hostages, let Yahweh's people go. Defend Israel. Remember Israel and everything we're doing today. Okay, the syringes in the park is a dangerous and intentional and negligent act. We can't have syringes around students and children and things like that. Parents coming in, parents with strollers, different things like that. That interaction is dangerous. It brings and it breeds those different elements that drug use, drug abuse, whatever people do for drugs, actually having those things happen there because the syringes will be there. It's not safe for the children. So the harm reduction services are actually causing harm because they're pushing the drug use instead of abstinence from the drugs. Now, if they see that they've been doing this program is not new. They've been doing this for many years. Even Joe Biden and a couple of people want to hand out syringes and things like that. That's not stopping the drug problem. You're helping them use. That's not a solution. So we need to stop saying we have a solution. Let's give them syringes. And then people sell them drugs that have fentanyl or whatever in there that causes them to have overdose. So merely just using the drugs is not causing the overdose, but the drugs being tainted and different things like that. So there are a lot of things that we do need to deal with. But giving them syringes and the ability to use drugs is not going to help them. We need services that will help them. I'm trying to implement biblical, Jewish, and Christian ways that we deal with these problems. The people in the churches, the Jews and Christians who do things biblically based, you do not find a lot of Jewish and Christian people that are on drugs. When we live biblically, we can have programs set up that way. When we do have programs inside the church that have elements of the other programs, that does not work. When we do it the way we do it, you find Jews and Christians, we're not using drugs. So giving people syringes, imagine us having that mindset in a church and have, just so that they can understand how heinous it is to have syringes at a school. Imagine if we had the syringe boxes and the harm reductions around a church, and we said, this is a safe place, let's let them come there and exchange, and they can use their drugs and feel safe. No, come in and let us tell you what we know to make you stop using drugs. What do you have for them to stop using drugs? Stop giving them syringes to harm themselves with drugs that are tainted.
Thank you.
You're welcome.
Thank you all for your testimony, for taking time out to come here. I know it's not always easy to take time out during the day, and yeah, oh, we have one more in person, I'm sorry, but I wanted to, just mention On Point St. Anne's. You guys are doing, I personally have been to On Point. I have not visited your facility, so I should come by. Yes, I will. Giving more work for my staff. I hear them already yelling at me. But yeah, I just want to thank you all for your contributions and everything that you're doing to help the neighborhood, so thank you.
Thank you.
Okay, and next we have Gia Mitchum. I hope I'm saying that correctly. And I apologize for you being alone. I know it was a late entry, so you have your own panel all to yourself. Okay, go ahead.
Okay. Good afternoon, chairs. Thank you for the opportunity to testify today. My name is Gia Mitchum. I am the New York Policy Associate at the Drug Policy Alliance. We are an advocacy organization working with grassroots groups and providers to address the harms of drug use and drug criminalization through health solutions, social supports, and community well-being. We are here to oppose Intros 868 and 1169. These bills would stifle the positive impact SRIN service provider programs are having in reducing the harms associated with drug use by limiting their accessibility of their services. I want to start by reminding the council that SSPs are a response to where drug use is already happening, and it's a response to the harms associated with drug use and the ways people who use drugs have been pushed away from care that supports them and communities. We share the goal for litter in our city to be adequately and properly removed from public spaces. Intro 868 would interfere with syringe litter cleanup that SSPs provide through mobile outreach programs. Mobile syringe service programs are street-based teams that provide a range of services in response to individual health needs of people who use drugs and broader community needs. Mobile SSPs provide services where there is a need, and this includes responding to needs near schools, in and around playgrounds and surrounding parks. So prohibiting syringe distribution in these areas means that schools and playgrounds would be effectively excluded from receiving the range of services that mobile teams provide, including syringe cleanup, emergency overdose response, and connections to health and social services. Intro 1169 contains a reporting provision about syringe distribution and collection by SSPs that disregards the multiple ways syringes are acquired and disposed of. In fact, the council passed a bill to create a syringe buyback pilot program that is about to launch, and we have serious concerns that Intro 1169 will create an incomplete picture of syringe disposal mechanisms that will be used to limit SSP services. Like other litter, syringe litter requires a combination of investments and strategies to address. Reduced stigma, increased access to care for people who use drugs, and increased capacity for litter cleanup are among the interventions that this council should consider. So we urge the committee not to advance Intros 868 and 1169. Thank you.
Thank you. Okay, so now we're going to move to, okay. We're going to move to Zoom testimony, so please wait for your name to be called to testify, and please select unmute when prompted. And first up, we have Senator Gustavo Rivera, who's, I'm assuming, joining us from Albany. So whenever you are ready, and we don't have a timer for you, so go ahead whenever you are ready.
Gotcha. I will not take, I was concerned about that because I might take a little bit more than 3, but But I will take just a few minutes, first of all, to thank you, Madam Chair, for having this hearing. And I certainly thank all the folks who were there in person. I do want to say, though, that I don't know what other members are currently present, but it is unfortunate. I'll share the concern that one of the earlier panelists shared about the fact that both Councilmember Feliz and Councilmember Marmorato, both who cross over in my district, had left. I'm not sure they returned, but I would hope that they would have stayed to hear the rest of the conversation. But, you know, they're not here, so I just wanted to express my concern. But they're both in my district, and many of the folks who actually did testify today are part of my district. So, and so I wanted to just say a couple of things off the top, which I think need to be stated for the record. And I would again hope that, I would have hoped that some of your colleagues, some of my colleagues, right, who are who are in my district would have stayed to hear for a second. We have to remember that addiction is not a moral failing. It is true that certainly for people like myself, I grew up in the 80s, so I had that message shoved into my head, you know, just say no to drugs, say no to drugs. It's as if though it's just a choice that one would make, and one that if you make the choice of using drugs, there's obviously something wrong with you. There's a level of stigma that is attached to the fact that we have thought for so long that addiction is a moral failing, and that stigma has led to some of the policies which have led to the incredibly concerning overdose deaths that we have seen for many, many years, but certainly the spikes that we've seen in the last couple of years. Addiction is not a moral failing, it is a medical problem. So it must be dealt with. We cannot criminalize it. Just criminalizing it does not solve it. If that was the case, if saying just say no and just we're going to criminalize people who sell it or use it, etc. If that was solving the problem, it would have solved it already. And I was also, and I would say that some of my colleagues, unfortunately, seem to just want to ignore the fact that that these practices from SSPs and harm reduction policies are evidence-based practices. There is data that goes back generations that talks about the fact that if we treat it as a crime, we're never going to solve it. If we treat it as a public health problem, we can make progress. And abstinence only does not work. It is true that certain people are just able to quit, but the reality of addiction is not that people can just go like this and quit. Most people can't. And we need to understand that. And the services, as somebody said a little earlier, and I believe it was you, Madam Chair, who said that we need to meet people where they are. And that is exactly what SSPs are, which is what I wanted to get to. The reason why many of these, because I'll talk about the location that Councilmember Feliz mentioned, because it is in my district. It isn't his, it is in mine. It's 532 East Tremont Avenue. Yes, that is right near a park, right near Walter Gladwin Park, right on East Tremont Avenue in the Bronx. The reason that is there, that van is there, I'm not sure which service provider is the one that is there, but that is because that is where the population is. SSPs, these mobile folks, go to places where the populations are, where people who use drugs are. And let's remember that all of these practices are about public health. This is about public health. The fact is that cutting off people from services, which is, as many of the folks today have testified, what this bill would ultimately do. It would cut off people from services because these vans go to the places where the populations are and connect them to services. Not only provide them needles, but actually provide them services and access to the services that they might need, etc. If they don't have those services, then they're not only going to maybe exchange needles, which actually would lead them potentially to have HIV, hepatitis C, other bloodborne diseases. That's what we want to eliminate. But also they wouldn't have access to the services, period. So folks are going to keep using. So this is what I'll end with, and I do appreciate you giving me a little bit of leeway. Look, the fact is that there are solutions here. We need to actually deal with the actual problem and not just try to go backwards in ways that we've tried to do it before. To criminalize something is not going to solve it. To treat addiction like a crime, to treat people who use drugs as criminals, to say that it's just, if I don't see them, they're not a problem. That doesn't solve anything. We have many things that we can do, and I'll just mention a couple off the top as I bring this in for a landing. First of all, the opioid settlement fund, which is a bill that I passed a couple of years ago, which has given the state, this is a bill which would take money that we get from settlements from pharmaceutical companies who exacerbated the addiction crisis and the overdose crisis because they marketed opioids as if though they were candy. But we've actually brought all sorts of lawsuits against them, and those lawsuits bring us settlements that then sit in a fund that, because of a bill that I was able to pass a couple of years ago, could only be used for treatment, for harm reduction, for recovery. And so I would say that part of the solution here is having the department of the city council to pressure the mayor's office, to pressure the Department of Health, to make sure that the money that comes from the state to the city actually gets used for the purposes that are being that the opioid settlement fund board is recommending. The recommendations that they have, these are experts in harm reduction, in treatment, in recovery. And so pressuring the city to make sure that those millions of dollars go to those services and expand those services, that would be best. Certainly, as you mentioned, the program that's just about to start related to the buyback program, it is going to start in the spring, and I am very much looking forward to that program getting off the ground and seeing how it functions. So we should wait for data on how that works, and make sure that we focus on giving more funding to those institutions. Certainly, Boom Health, St. Aaron's Corner of Harm Reduction, On Point NYC. These are all folks. These are all agencies, some of them in the room there, that actually do this work. They pick up syringes, they identify the places where they are, and they work with the community. So finally, I'll finish with this. I was very glad to see the Friends of Echo Park. These are a group of community members who, as they themselves have said, have made an evolution based on how they view the work that these folks actually do. And I would plead publicly to my colleagues who are still insistent that the way to deal with this problem is to further criminalize, to push people to the side, to eliminate the possibility of these places, of these vans being where they are, et cetera, et cetera. I would plead for them to do the same thing that these community members did, to actually talk to the providers, to go and see the work that they do, to ask questions of the people who are being served, the users themselves, to visit some of these facilities. I would ask them to do that, and hopefully when we do that, we can all come together and say, let's actually focus on real solutions, not just something that sounds good and makes us feel better, but doesn't actually solve the problem. So with that, Madam Chair, thank you for the leeway, and certainly if there's any questions, I'll take them, but thank you so much for having me this morning.
Thank you so much, Senator. Actually, you'll be happy to hear that last month, we actually had our second oversight hearing about where the opioid settlement funds have been going, how they've been spent, because, and I know that we have folks from DOHMH still here, which I appreciate you guys for staying to hear the testimonies, but we're drilling down, we're trying to drill down even further. We can have an offline conversation after this, but I'm very, very much on that, because I want to make sure that the funds are going to the groups and the zip codes where it is most impacted. That's where we need to make sure that that money goes. So I'm right there with you on that.
We're full in agreement, Chairwoman. Thank you so much for that.
Okay, thank you. And next we have Richardson Benjamin, followed by Gregory Bunt.
You may begin.
Thank you so much, Madam Chair, for giving me this opportunity. My name is Richardson Benjamin. I'm the PTA president of PS 28 Mount Hope on Tremont Avenue, Anthony Avenue, 1816. I'm on this meeting because I want this bill to be passed because needles, we have been seeing needles in the school for decades. And this is something that is going on, and I'm fighting over years and years when I became the PTA president, and which I have to do press conference outside the school. Every morning, custodians call me to tell me they see needles, the school premises in front of the school entrance. And we have 3 to 5K students coming into the building, and which is unacceptable because these kids can be pricked and they can get any infection, HIV, AIDS, or hepatitis B or anything. So I would like the intro 1169 to be passed and 0682 to be passed so that these things will be stopped within a public school or elementary school vicinity or our parks, because it's something that is causing a lot within our school and our district.
Okay, great. Thank you. And just really quickly, a follow-up question is, have you been in touch with and partnering? So when you see a lot of, according to yourself, I mean, I know the parents have concerns, but have you been partnering with some of the groups that work on this, or the Parks Department? Yeah, just sorry.
I think before it started, Senator Gustavo was then time the senator around, so we called him to reach out to his office, and I reached out to the borough president office, and then I reached out to the council member office, but we also reach out to community board 5 so that we can deal with this issue. But they promised that they'll clean up the place, but sometimes during school hours it happened, so I wasn't seeing any changes. So this partnership, they tell us they will do it. We went, sat down with the management, nothing was being done.
Okay, thank you so much for sharing your testimony.
Thank you too.
Next we have Gregory Bunt, followed by Desiree Bell.
You may begin.
Okay, can you hear me and see me now, Chair?
Yes, we hear and see you.
Okay, very good. Okay, thank you for the opportunity and invitation to speak on this very important topic. I believe I'm speaking on the proposal that you sent me regarding a resolution calling on New York State to mandate basic training and addiction treatment as a requirement for medical schools that receive state funding. Is that correct, Chairwoman?
Yes. Oh yeah, we're hearing that bill today at the committee. Yep, that's one of the bills.
And that's why I'm being called to testify on that particular resolution, correct?
Yes, and if you want to comment on the others, that's great. But you don't have to, sorry.
Okay, well, and with regard to the others, I would just comment shortly that the role now of addiction treatment providers is kind of twofold. One is treatment that advances toward rehabilitation and recovery, so significant periods of abstinence. And the other, which is different really, is harm reduction and overdose prevention. So it's a really two-pronged approach. So you have to understand what you're doing, and both are important, but those are the goals. And I think a lot of the people who testified were speaking on those two different issues. But those are two different goals in terms of treatment programs. So I want to address now the resolution. I believe you developed that resolution, Chair Lee. You mentioned that in your introduction, the one calling on the state to mandate basic training in addiction treatment in medical schools.
Yes, go ahead. Mm-hmm.
So with regard to that, what you lay out in terms of a conceptual framework, I think is excellent. You talked about the impact of addiction on the community, that it's the #1 cause of mortality among young people, a real #1 public health crisis. It also that overdoses can be prevented. But beyond overdoses, I want to mention that addiction causes extreme harm to not only individuals, but families and communities. The impact of addiction in terms of public health and community well-being is staggering. So that should be understood. Not only are overdoses and overdose prevention a priority, but also the treatment of addictions, which causes so much distress and tragedy among individuals, families, and communities. You mentioned that addiction is a treatable disease, and as I said, it is a treatable disease, and you're spot on with that. The goal of helping people rehabilitate and achieve recovery is really important, and many people do achieve recovery that involves sustained abstinence for significant periods of time. So they're off drugs. The harm reduction is another priority, but it's a public health issue, and medical professionals play an important role, you state, which is, again, spot on. Do they get enough training in medical schools? And I believe we can do better, and I believe that is why you developed this resolution, and I certainly honor and respect you for doing this, but bringing attention to the importance of medical education for the treatment of addictions, a treatable disease, and the #1 public health problem in our nation, around the world. As you mentioned, the use of opiates for the treatment of pain, doctors and medical students should know the adverse effects of using those opiates, but also the effectiveness when used judiciously and as prescribed. That's different. The comments I have regarding your resolution, Chair, and again, I say this in due respect, I commend and honor and respect you for this resolution, bringing attention to this most urgent critical matter, is that the resolution, I believe, states that you would recommend to the state, New York State, to mandate basic training and addiction treatment as a requirement for medical schools that receive state funding. I think there are a few important questions that should be answered. First of all, what does it mean by basic training and addiction treatment? If you mandate something, how much time is that going to take and effort in the medical schools? And the faculty who develop the curriculum are going to want to know very specifically, what are you talking about? How do you define basic training? The second is there is, of course, Council on Accreditation for Higher Education, and they do develop. I'm not even sure, in an area I'm interested in, but I haven't kept up with the latest. I don't know the current requirements by that council, but I think we should know that. And second, what medical schools are doing now? I think there should be a survey, certainly of the medical schools in the city that have a curriculum. Some medical schools are making significant progress. We've worked with the New York Society of Addiction Medicine. I'm the past president of the New York Society of Addiction Medicine, although I'm not speaking on their behalf. I'm also the medical director of Samaritan Daytop Village.
Yes.
I'm not speaking on their behalf, and I'm a clinical assistant professor of psychiatry in addiction medicine at NYU School of Medicine. I'm not speaking on their behalf, I'm speaking on my own, but I do think that a survey of what the medical schools are actually doing in terms of addiction treatment, that is important to understand. What
and I'm so sorry, Mr. Bunt, if you could just wrap up, because you've gone over time. Yes, and then, but these are actually really good suggestions that you're providing us right now. And also, if you could submit written testimony, that would be amazing, because we want to capture some of the ideas that you just mentioned.
Yes. Okay, I'm finished, but thank you.
Thank you so much. Okay, and next we have Desiree Bell, followed by Walter Bell.
You may begin.
Thank you. Good afternoon, everyone. I hope everyone can hear me. I do have some comments on some of the things that I've heard so far. I've taken a lot of notes and I've heard from all the parties involved. I just want to thank Council Member Oswald Feliz for bringing this. I know it's hard to challenge some things that after things have already been predicated and implicated. I do see some inordinate self-interest involved in some of these statements. I am a youth, and this is my first time attending a legislative hearing. So, you guys could keep that in mind. But, I think Oswald Feliz and the other members of this panel should not have to explain themselves on why this is a concern. I've seen not too long ago how himself, George Alvarez, and Mayor Adams had to walk through the Kingsbridge underpass due to the prolific amounts of needles and harm that has been done to that area, and that is reflective across America. I'm here to really speak on some of the things that I heard earlier about specifically the regulations of these programs, and I can speak to these things because I've had to go through the process in which, at the moment, we are not a part of that at this point, but I've had to go through the process. And I would like it to be properly accounted for. So I did hear some things. I did hear something. Well, first, I will say this. It's not only syringe service or exchange, whatever the term is going to be at this point. There are also opioid overdose prevention programs also done through the New York City Department of Mental Health and Hygiene. I didn't really hear that accounted for. But we are also a part of the combating the overdose epidemic. We've given 25,000 Narcan kits, et cetera. These things also have to be talked about. That's not, again, we talk about not the only solution. But I think what Oswald Feliz is saying here, and I do hope that either if he's not there at the moment, that this message will reach to him. What he's saying is, again, accountability. No one's saying that these services can't be provided or, that I don't really hear that is being restricted. I hear more of an accountability. He's already stated how the Department of Health has been unreachable for the last 3 years. We've presented this to him, Community Board 6 and Community Board 7. We presented needles to the Department of Health, to which we were told, we can't track the needles. We were told a lot of things of a lack of accountability, and we see the result in the most needed communities, aka Black Americans, aka Latinos, aka there's other populations that have been affected by the gross neglect of lack of regulation. There were no site visits on any of the programs until us. So that already goes to show that there was already a lack of accountability.
Sorry, you can go ahead and wrap up in the next few sentences. Go ahead, sorry.
Sure, that's no problem. Thank you for letting me know. But yes, definitely. I just want to end with this. Your question that you had, Madam Chair Lee, you asked the person how can the needles be tracked? There is a way actually to do that, because I just want to remind everyone here, there are serial numbers attached to the syringes. These are medical supplies, so there is regulation on who belongs to what. So I will say that I will support Oswald Feliz and what he said. There should be an integrity ban as far as the modification of how the services are provided. Thank you, everyone, for allowing my testimony.
Thank you, Desiree, and congrats on having your first testimony at a hearing. And next we will have Walter Bell, followed by Jason Beltray.
You may begin.
Is my audio on?
Yes, we see you and hear you. Yep.
Thank you. Good afternoon, everyone. You just heard from my daughter, and I want to thank Desiree for also having her first time testifying. But this is a work that I've had my daughter doing since a very young age. We've been out in the community within Community Board 7 and in different areas of the Bronx. We presented the needles to the different community boards. However, at this time, with this critical moment, we found that this is almost unacceptable. It should be a no-brainer that this bill shouldn't even have to be crossed. The needle should be nowhere near schools. Schools are considered the highest forms of education for any government or any country. And with that being said, that's where the beholding of knowledge is. So if that's where the beholding of knowledge is, then we can't have poor qualities of life around schools. Around schools is not a place where we should be seeing needles saturated all over the place. One other key point is that people mention On Point, St. Anne's, and different things like that. Well, I commend those organizations for the services that they provide. However, if this is business, then there's a problem. Because in an 8-hour shift, if you work in the daytime and you pick up needles, what we do is we come at nighttime and find out that there's even more needles in the night. So it has to be coming from within the community where the problem is. These different organizations, they in different locations. They come to other locations to do the work, to pick up the needles. But we should have communities or organizations from right within that community that do the work, that want to do the work of improving the quality of life of their own community. And that's a major problem that we find with the SEPs. So that's the second part. The last part is that if we look at the numbers in New York City, the numbers for overdose episodes have gone up tremendously. I have to cut my thing short because someone's calling me. But the numbers have gone up tremendously. My daughter mentioned OOPPs. The overdose fatalities in the Bronx, New York, specifically, Oswald Felice's area, Gustavo's area, and the other senators and councilmen's and assemblymen's area in the Bronx is horrific. We got to stop playing games here. We need to put a period to some of this. Now, if you look at the overdose fatalities, just Hunts Point, Kingsbridge, Tremont, and 1 or 2 other areas, Morrisana High Bridge, they've had more overdose fatalities than all the other boroughs combined within the last 2 to 3 years. So coming up with a different concept, it should be just as much respected and appreciated with what these bills are trying to say, that we need to do a little bit more cracking down on what we're allowing to happen in our community. Remember, we are allowing this to happen in the community. Yes, we understand that there's addiction.
Your time expired.
We understand that addiction has situations, but we also have to understand that we also have to have a certain amount of integrity that goes along with the work that we do. So I thank you for allowing me to share and my daughter to share. We're a family of scientists. We're a family of people who reach out and support our community, and we do whatever it takes to be able to do that. Thank you very much, and y'all have a blessed day.
Thank you so much for your testimony. And finally, we'll have Jason Beltray. I hope I'm saying that correctly.
Yes.
Okay, go ahead.
Beltray, I serve as the Director of Community Initiatives and Impact at On Point NYC. I'm testifying today in opposition to intros 0868 and 1169. My program, the Outreach and Public Safety Team at On Point, provides essential mobile services in Upper Manhattan and the Bronx. And of course, we're also operating the city through overdose prevention centers. Our mobile teams play a vital role in supporting community needs, including responding to areas of need near school and playgrounds. Not only are we collecting syringes, but we're distributing much needed supplies like food, clothing, and connecting people to care. Schools and partners throughout the community and area can easily access our services through our public safety hotline, allowing us to provide support often immediately. I want to highlight how our Overdose Prevention Center also aligns with our shared goal of keeping our streets and parks free of syringe litter and hazardous waste. When we first opened our Overdose Prevention Center in Washington Heights, our partners in the Parks Department reported a decrease in syringe litter from 13,000 syringes monthly to less than 1,000 syringes monthly. Additionally, since September 2024, we've collected over 2,000 syringes from one school location alone. We visit schools twice a day before drop-off and dismissal to help ensure an environment that is safe for students. Beyond the syringe collection, we're working in collaboration with schools in other meaningful ways. For example, at our Washington Heights Wheel School, we've partnered with their Stew Crew, their Green Corridor Lab, and their work-based learning program for multiple years at this point. The work-based learning program has been a unique opportunity for us to employ interns whose lives have been impacted by addiction, or for those interns who are interested in pursuing careers in the medical field. Both the Stew Crew and Green Corridor focus on community cleanup and overall well-being. In conclusion, the work that we do in this community is vital for public health and safety. We strongly oppose the proposed legislation and that this would hinder our ability to support the community in these essential ways. Thank you.
Thank you so much, and thanks for the work that you do. Okay, so I'm gonna call a few names that have signed up and just wanna make sure that we don't miss anyone. So if you are here, please let us know. We have Amanda Wexler, Anthony Feliciano, Terry Troya, sorry. Cirio Guarino, Lakeisha Ricks, Gordon Lee, Emily Tippins, Victor Otero. Is anyone here from that list of names? If not, no hands on Zoom. Okay. Okay, seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. And with that, I'm going to close out our hearing. And feel free to reach out to us if you have any questions, thoughts afterwards. So thank you.